comment for this, or
We'll let Patrick Costin know when you're ready, and he'll let you know when we're set up.
Every time you say Patrick's name, he sounds like a football player.
Sweet.
Patrick
I appreciate that. Okay. All right. Recording started. So once you're ready, go ahead.
Okay. So we'll go ahead and call the meeting to order for the UFA Finance Committee. And the first item on the agenda is any public comment or input. And I don't know, Cindy, have we received anybody in writing?
No, we haven't. And no, we haven't.
Okay. All right. So we'll go ahead and move on to the next item, which I think is the approval of the minutes from the last meeting. Anybody want to give a motion?
Jeff Silvestrini, I'll make a motion to approve the minutes.
Mayor Peterson, Collet Heights, I'll second it.
And then I just roll call. We're going to Hale. Mayor Hale.
Yes.
Okay. Perry.
Yes.
Peterson.
Yes.
Silvestrini.
Yes.
Sondak.
Yes.
Stewart.
Yes.
Okay.
Okay.
Thank you.
So transitional plan chief, if you want to talk about that for the elimination of district chief positions.
Yeah, I'll give an update, and I even have a little more than even this memo was able to share. So this is just, we have certain things that we've put into the budget, and I think we have an opportunity here to make some adjustment to the budget that I'm thinking is appropriate. The first one is we had talked about eliminating the step plan for the assistant chiefs to protect from the ops position, but in reality, I think without the market adjustment, I've decided not to do that and just leave the existing, maintain the current AC steps as they are. That actually saves $16,000 in the budget that will change. And when we consider the market adjustment, we can reconsider that compression that exists. It didn't change the top step of AC, it simply eliminated some steps, but I want to tie that into the market adjustment whenever we consider that as a group. Second is the redlining. And here I just tried to outline the fact that part of the strategy of proposing redlining for the district chiefs was the fact that we were looking at a market and a CPI, and the total cost of that would have been about $13,000. But without the market, without the CPI, and adding in potentially 2 battalion chiefs, the costs become $80,000. And I think it's a lot more than probably we anticipated when we first prepared it, and more probably than you considered. We also just received a notice of a retirement at the captain level. So with that change, if we remove the red line position and remove one captain position, that allows us to bump 1 battalion chief down into captain and take 1 position out of the budget, because we funded 2 additional battalion chiefs in the position in the budget, considering this transition away from the full process, if that makes sense. But with 1 retirement, we're going to be able to reduce 1 position out of the budget. We are moving forward with the concept of holding on to 1 roving battalion chief that would fill vacancies across 3 shifts. It ends up being about the same cost doing it at a captain level or at a battalion level. So 1 battalion chief extra will eliminate the need to bump down 1 battalion chief to captain, and they will fill the vacancies. It ends up being pretty much the same cost as if we had bumped them down to captain. It'll just be at a battalion rank. So if we eliminate that bump, eliminating the red line saves $63,000 in the budget today. By having the captain retire allows me to reduce the budget by 1 battalion chief position, which saves another $150,000. So if we maintain the current AC steps, remove the red line, and then go ahead and eliminate 1 position out of the budget because of that retirement now, I can give a reduction to the budget of $229,000 right now. So I'd like you to consider this during your deliberation phase. Councilman Stewart, if you want to ask questions or talk about it now, that'd be great. But I'm recommending that for a number of reasons, we eliminate this red line because of the new cost and because of the potential precedent it sets without a change in policy.
Yeah, I would say I would agree, Chief Peterson. I've had a little bit of dialogue, and I think that's a good move. It's always hard to take that step back, but I like the way that you've been creative with that. Personally, I don't want to speak for the rest.
I applaud the effort and the sensitivity to these challenging times. And well, we've all had to make sacrifices. I appreciate that effort on your part and realizing that it's all something will be reviewed later on the year as things change as well. So I applaud the effort.
Anybody else? Okay. Chief, I would say we're probably, from the Finance Committee, it sounds like we're supportive of your direction. So I would go ahead and move forward with that. So getting into the budget presentation, if everybody's good to move on to that, we'll go ahead and turn it over to Chief for your introduction.
So hopefully you've had a chance to review the budget. We know that all of you ended up looking at it electronically. We didn't have any of you come to us for a hard copy. So I think, like Mayor Silvestrini has said, we're learning how to work more electronically now, and that may be a good thing. We saved a couple trees by having you look at it electronically. Still real interesting times, a lot of uncertainty about the economy. We did a lot of work to streamline our budget before COVID, trying to really focus a lot on quality and reduce the support services to make sure that we were doing service delivery as much as possible. We dropped the market and CPI adjustments after the COVID impact, which dropped the member fee from 4% down to 2%. All the staff are here and they're in the waiting room there with as attendees to discuss their budget. And I want to share that we've all focused on providing value, transparency, but these division leaders all have real ownership in what they've got in their budget. They're going to give you a really brief overview of their division, and they've been told to be very, very brief, right? And then make sure that point out a couple of key things maybe that they want to make sure you're aware of. And then I really want you to ask questions. I mean, the job here now is we're kind of turning this budget over to you for some ownership. And they're prepared. They're prepared for difficult questions. They're not going to be offended by difficult questions. Now, this is where our partnership comes in to make sure that the budget is truly reflective of what's best for the community. And they're ready for it. They're not going to be offended by that at all. As we move forward, Tony has a spreadsheet that he's going to capture any items that you want to put into the deliberation phase. And if you look at item 7 on your budget, there's time for you to talk in more detail and make a decision on where you want to be, what additional things you want to change. The spreadsheet that he'll start working and capturing as you go will actually define what the member fee adjustment is both globally and for each entity as you move forward. So if you want to add or subtract items to that and see what the impact is, you'll know what that looks like. For instance, the $229,000 savings that we'll show at the top of the spreadsheet will start off with a 0.4 reduction in the member fee. So right off the bat, it'll drop us from a 2% to a 1.6% member fee adjustment. However, we also have found just in the last week an additional increase in our liability insurance that we'll talk about in administration. That's another $25,000 hit to the budget. And we do have some options to potentially reduce that, and we'll talk about those long term. And in medical, we're moving 2 positions out of the medical division but they're asking to hold on to a captain position instead of a specialist. So while they're going to see about 250,000 in savings, they're asking for holding on to a captain reduces those savings by about 14,000. And he'll talk about that in medical. Those will be on the spreadsheet as well. And with all of that together, we're starting out before you even talk to the divisions with a 0.33% reduction in the member fee. And with that, I'll turn it over to Tony, and you'll see Patrick will bring in the division chief, and we'll just flow through the rest of this items quickly. And you get as much time as you want to ask questions or dig into that detail. So with that, I'll turn it over to Tony.
Thank you, Chief. Finance Committee, it's great to be here today and to be able to talk to you about our budget, FY 2021 budget. I'm going to just quickly introduce the next section in the budget. So if you're following along, we're on page 30, the PDF numbered page 30. There is the finance budget message. What this section provides the board and any reader of the budget is just a overview of the financial position of UFA. Some of the highlighted areas that you can learn a little bit more about the UFA as you go through our budget calendars in there. Our FTE summary is in there. That's obviously an important chart for the board to understand where we're sitting on FTEs. And the top of page 27, there's the new FTEs that are requested in the budget for this coming year. So encourage you to look at that. You know, we have the 9 new FTEs to finish, new firefighters to finish the transition of the full-time ambulances. That's in there. But the net number, including the 9, is actually 7 new FTEs. So there's a 2 FTE reduction if you exclude the 9 new FTEs. So anyways, that's an important chart. We just have some information about the fund balance, where our 5 funds are sitting with the projected beginning fund balance and where they be at the end of the year. If the budget's approved as presented, there's a 10-year budget history for the general fund that's there. And then as you get towards the end of the finance budget message, we have a long range plan in the budget. So you can see where we've been back to fiscal year 17-18, where we look with the proposed budget for this year, and then a projection for the future years of the UFA. So that's a good document for you to have a look at. And then finally, I would just call your attention to at the very end of the finance budget message, there's a new section, the fee schedule. And so this captures all of the fees that our divisions are presenting to the board for approval. And so we'll just want you to feel comfortable with those. And when you approve the final budget in June, we'll be asking the board to approve the fee schedule as well. So that's just a quick overview. There's, like I said, there's quite a bit of information, but a quick overview of what you can find inside the finance budget message. Be happy to take any questions from the board on that at this point.
Tony, I don't know if there are questions, but I just want to say how much I appreciate all the work that you put into this, and you know, all that information is really outstanding to be able to see that in one place, and the history and all that. It's really helpful. Thank you.
Thank you, Mayor Silvestrini. Appreciate that.
Yeah, Tony, I'll just echo Mayor Silvestrini. I really like your letter this year. I know that you've done it in the past, but this one seems a lot more enhanced. And it was actually something I used to kind of base some of the discussion I had Tuesday night with my council about those that may want to attend this meeting today. So I appreciate it.
Thank you. Appreciate that, Chair Stewart. If there are no questions, I'll introduce.
A couple quick questions. Sorry.
Okay. Sorry.
No, you're fine.
Councilman
Can you remind me on the other income on page 32 of in the PDF? It jumped up quite a bit last year and then has dropped back down. I'm not sure. I can't remember why that was.
We just find where we're at here.
It's, yeah, page 32 in the numbered pages.
Yeah, so we generally budget that number. It comes in, there's hardly ever any other income at the start of the year, but what ends up flowing in there is when we go on an EMAC deployment, that drops into the other income.
Okay.
Things like that pop up throughout the year that we don't ever plan for, but you know, we get revenue if we go on a USAR. Those types of things will pop into that line.
Okay, that's good. And then a couple other questions, if you don't mind. This is kind of what I noticed, and it's highlighted here, actually on page 34, but it kind of flows throughout all the separate budgets. I noticed the computer software jumped up quite a bit in several of the budgets, and then the janitorial supply. Didn't know if there's any specific reasons for that, or just kind of.
Yeah, and we'll of course get into that. I don't know if you want me to jump into that now. We can, or each of the divisions can do that. But
Yeah, we
I
can.
know you want me to.
Increase price of toilet paper on the janitorial supplies.
Yeah. No, you can wait for individuals.
So I would say, Alan, hold those questions when we get to IT. That would be a great time to ask that computer software question, and then logistics can jump in on the janitorial. I mean, like I said, I got the answer. We can go now if you want, or let's let the divisions answer those as we roll. So are you okay with that?
Yeah, that's fine. Okay. Thanks.
Any other questions? All right, if not, we'll move to the next section of the budget. It's my pleasure to introduce Assistant Chief Zilkowski to talk about the strategic plan.
There we go. Make sure I'm off mute. Good morning, everybody. Thank you. It's good to see everyone. Yeah, just to briefly share, as in years past, we're including inside of the budget document our strategic plan. The strategic plan has been in effect for the last 2 years. We are now on the last year and last iteration of this plan. Recently reviewed with the Strategic Planning Committee, the document itself, all of the outcomes. As you recall, the plan is broken out into 6 goals with goal statements and then several outcomes. These outcomes are what good looks like if in fact we're engaged in the accomplishment of those outcomes. These outcomes are then used by the divisions and assigned to the divisions in the creation of their action items, which then rolls into their specific divisions as part of the budgeting process. In other words, if there's a fiscal tie to the action items, that then rolls back into the outcomes. So going back to the committee piece, in the review, I'm pleased to report that we were able to provide a complete update to command staff, which they likewise have approved. And so the strategic plan document, beginning on the pages where it breaks down each of those outcomes, contains 3 categories of ongoing, complete, and in process. In the coming year, meaning this current calendar year, DC Brian Case will take over on the creation of the new strategic plan document, and some of these ongoing and in process outcomes will likewise be reviewed and maybe perhaps roll into the new plan. Any questions? Seeing none, we'll turn it back to Chief Peterson then to walk through on the member fee. Thank you.
So I wanted to just kind of do a little bit of overview and a reminder of how we got to this space. Prior to 2017, we worked on an FTE model where the positions in everybody's area were costed out by the total cost of the member fee. And then there was sharing back and forth between agencies about those FTE components. We found it very difficult to kind of put some science behind what that meant and how that worked in the service delivery. So through a good share of 2017, we went through the entire member fee program. We looked at various ways to determine how to decide the cost. Population was talked about as an option, and this was with the Finance Committee at the time. Councilman Stewart will remember this. These discussions as they went through, they were pretty lengthy. We talked about population as an idea, but one of the challenges of population is that our cost of serving an area is pretty much the same, whether there's 1,000 people in the first due area or 20,000 people in the first due area. You still got to put a company in service to protect that community in order to meet those needs. Higher density areas with a small footprint are less cost per person than the other. Industrial areas can generate a lot of revenue, can be pretty dangerous, but don't end up having very many people. Resort towns can be a high cost per resident, but experience a massive influx of people as they come in and out of those communities. Inside of our area, we have a wide range of cost per person. Kearns is densely populated and only ends up being about a $58 per person, whereas immigration, which is stretched out, has a lot of risk and a lot of area, ends up being about $1,100 per person if you were to look at the cost of service. So population was disregarded as the best option to determine how to decide what the cost of service should be for each community. Call volume was also talked about. And call volume alone is a tough one because, again, we need to put a station in service to protect areas based on ISO ratings and coverage and being available for fires. And it doesn't make much difference in cost whether there's 300 calls or 2,000 calls. It doesn't make much difference as a global definer of service. Higher call volume doesn't necessarily change a significant number of cost until you hit a number where you need to put a second company in service, where it's busy enough that now that true cost of fire protection increases if you have to add a second company. What we landed on through that process was the current member fee system, where it's really based on the stations and staffing levels on the heavy apparatus first due area. It is the primary method that pretty much the fire service across the country delivers service. It's the significant basis for your ISO rating for how that works for insurance. And it's focused on a quick response based on the coverage of the area. Shape and size of a city can often define the cost. 4-minute drive time, 3 or 4 person crews are the varieties that end up to be actual cost. And it doesn't matter if you're serving an extremely high value area or a low value area. The coverage is important to be in there. And the number of stations and staffing becomes the primary driver. And the remainder of the regional costs were split equally through. It had a unanimous approval by the Finance Committee and then by the board, and was implemented in the FY 18-19 budget cycle. Like the ambulance revenue and the ambulance services for transport, it offsets the cost of ambulances, and then that is a regional response because ambulances move over the entire district routinely. They don't have as narrow a first due area as what that fits. When it comes to responding, we respond operationally based on where the call is, not what the political subdivision is. When there's an overlap, then that's the only time we really look close at the call volume. So we look specifically at a first due area that overlaps 2 members. We look at the municipality's calls over a 3-year window, and we split the cost based on that call volume. And the theme of that, and the reason finance supported that idea through the process, was it's the amount of time the resource is actually being used. They decided not to worry about the type of call, figuring that those would balance out over time, right? So it was simply said that if one side if one part of the first due area is getting 30% of the calls and the other's getting 70%, then split the cost of that station accordingly. Operationally, though, our battalion chiefs can go respond as if it's just one district overall, which is really important so that the community gets the closest unit no matter what. And then we fill that in through the backside. And then when it comes to UFA, of course, which makes it, if you're trying to compare us to other city fire departments, for instance, the thing that's different is that you get all your normal emergency response, fire prevention, training, medical, but you also get all of the administrative work, the board clerk, finance, purchasing, HR, legal, all the state transparency requirements, all of information, community outreach, logistical needs, liability insurance, workers' comp, dispatch services, apparatus and equipment replacement, fleet maintenance, and all the specialties that are in there. You don't get your fire station as part of it because UFA doesn't buy the fire station, the member does, but you do get all your routine maintenance and your significant work on the station is all embedded into the budget. So that was how we got to this process. And it was a pretty lengthy conversation, pretty lengthy change back in 2017 with the implementation. I don't know, Councilman Stewart, if you want to comment on your memory of that. That was a long process we went through.
Yeah, I mean, there was a number of different pieces that went about, but I think the biggest thing was we were trying to find a way to balance the way that everybody would look at the service delivery and the way that everything went. And so I know it was particularly important for us as a city to see this demonstrated this way, just so that we felt that we would never be overtaken in a situation where I use the example as if Immigration Canyon and all the canyon cities got together and decided they wanted to buy a fleet of helicopters to fight fires, that the cities that didn't have that need would be able to have some way to deal with that.
Chief, I have a question, and I don't have an answer to my question, but I'm going to throw it out anyway because I don't have a solution. But you mentioned a moment ago that call volume typically is not the determining factor on what's charged to a member city. Because if you have a crew and if they're going in on 20 calls or 30 calls, the fundamental cost really doesn't change, except when you are sharing a station with maybe another municipality.
Right.
Now, on this current budget cycle, because of that formula, our city is going to be charged an extra $100,000. Yet, when I look at that, if our call volume changes 2%, I don't think the fundamental costs have changed at all. I don't have an answer. I don't think there's a better way to do it.
Right.
But I have to tell you, we got hurt by that a little bit this year going forward. Yeah. But I really don't. I can't think of a better way to do it. You and I have talked about it before, and we've looked at it. But it impacts us more than anyone else this year, probably for $100,000 during a tough time.
And it's not a full 100,000 for you, but it is a greater impact, right? You would have had some in there, but I think this is the first time that we've seen that dramatic a switch, right? There was a 500 call increase in Cottonwood Heights 3-year comparisons and not the same corresponding increase in the neighbors. Most of the time, what we've been seeing across the board is one community sees one station receives an increase, but it tends to be proportionally equivalent between the two communities, so it doesn't matter, right? If a call volume goes from 1,800 calls to 2,500 calls, it has generally been proportionally increasing the same, right? But what we're learning from this is that we're going to start tracking this a little closer earlier. We had a great meeting with your city manager and finance.
Yeah,
we're going to look at why is that and be a little bit more in tune with it, because if in fact it's a care facility that's calling us way too much, we want to fix that before it becomes this issue for you. Does that make sense?
Yeah, no, we understand and we appreciate the dialogue. It raises a question, I have to be honest with you, but I applaud the effort. I'm aware of the process that you've gone through to get to this point, and we understand, and we appreciate going forward and looking at that data and adjusting accordingly if it's appropriate.
Right. But part of the dialogue that we had at the time when we were adopting it was actually to make sure that you were conscientious about what you approved for your community, right? And so specifically, we talked at the time in late 2017 that if you're splitting the cost of a station with another member, and in UFSA, it doesn't matter. We don't worry about that split. But between the members, if one community builds a high-rise office building that generates very few calls, right, which it tends to not generate, that's one thing. But if another community builds 2 or 3 care facilities that are high demand on the fire service response, it will impact your cost and time. And so it's a good opportunity to make sure we think about what we're doing in our planning and zoning with regard to the call volume. What I think our learning here on seeing this was a surprise to me as well, Mayor Peterson. When I saw the numbers initially, I turned back to Tony and said, send that back to review. I want to know. He sent it back, it came back, and then I shot you a message saying, just got this.
Yeah.
But now our liaison is digging in to find out why. And if we find that you've got a couple of high users, not uncommon for a care facility to use 911 in replace of their staff to avoid insurance injuries, paying for back injuries for their staff. I can't tell you how many times over my 40 years that I found a policy embedded inside of a care facility that says, do not pick patients up when they fall, call 911. And then we have to go in and help educate those players. Some of those facilities can generate 5 and 6 calls a day, which end up being inappropriate. Really, the staff should be taking care of that or finding equipment. We're going to find out what that issue is, but what our learning came from this is we're going to do it more often. We're going to look at these things more critically before all of a sudden it's a discovery that you have to now deal with. Does that make sense, Mayor?
No, it definitely does. And I just want to go on the record that we've had those conversations and we're working with you on it. It is a fiscal impact to us, a difficult time, but I understand and I applaud the formula we have now. At least there's a formula and we can look at that rather than guessing. So
right.
Appreciate the effort.
So with that, I'll turn it over to Tony to kind of start walking through the member fee portion of the budget.
Perfect. Thanks, Chief. So now we're on page 65. If you're following along in the member fee section, this chart was just introduced actually quite well there by Mayor Peterson. But the chart on page 65 shows the service demand in 2016 to 18, and those are the numbers we used in calculating the member fee in last year's budget, and then in the blue, the service demands when we add 2019 for the newest 3-year numbers. And then the key is the yellow numbers, and you can see the ups and downs. These are the only 4 stations that UFA runs that splits calls between members. And so you can see in the yellow the ups and downs that the new proportion of the calls will show in the member fee. And so in the proposed budget, there's a 2% member fee increase, but because of these percent changes and the percent that belongs to each member, the 2% will adjust a little bit in between members. And this chart here is the driver on what those adjustments will be on the actual member fee, which we'll look at here right now. So 65, 66 just shows a quick map of the stations that are sharing calls between members. But page 67, that's the member fee chart for the FY 2021 budget. So as Chief's mentioned in his budget message, 2% increase across the board. There are a few adjustments that make that number be 2.72 for the whole UFA, and those adjustments are the 4th person that the UFSA is now added to the engine in Eagle Mountain Station 252. So there's the member fee increase. It shows Alta joining the UFSA as of January 1, and then the impact to each of the members, including the new proportions. The last chart in the member fee section just provides each of the members a nice snapshot of how much they're paying for each of the divisions inside of the UFA. So if you're if you're Cottonwood Heights and you want to know how much you're paying for fire prevention, you can see that on there, or for the EMS division, or for HR, etc. And so that actually, I think, provides a nice information for you to take back to your cities to be able to say, look, we're paying $84,000 in Cottonwood Heights for fire prevention. We have access to all 10 of the inspectors there that UFA has, and we have access to an inspector in our city at all times. So I think that's a great chart to help you understand where your dollars are going inside of the UFA division. So that's what the member fee looks like in the proposed budget. Of course, we already have talked about some adjustments to that from Chief Peterson, and we'll get into any others that you would like to in the deliberation. Questions.
Tony, you kind of cut out at the end there.
Oh, I just was saying I'd be happy to answer any questions about the budget, the member fee, and the proposed budget.
So really quick, a little bit confused, so I'm just trying to understand it. When you look at this fee breakdown by station, for example, in my city, I see station 121 and 124 have the same amount of cost assigned to them, but 121's four-handed and the 124 is six-handed.
Are you talking about because of the ambulance?
Yeah, I can speak to that. The ambulance, all of the ambulance assignments are regionally shared in cost. So they're not embedded into the staffing costs. So the only staffing cost we're dealing with are the engines and trucks, the heavy equipment. So the total ambulance service is identified by the total cost for the ambulance, offset by the revenue, and then the net expense is shared across every single station inside service delivery. So it doesn't become a direct cost to any one station because of that regional model. And the reason is that they move around everywhere and they don't have as small a footprint for first due. And Kate will kind of cover some of that here in the next agenda item as well, to help lock that cost down.
So that's the reason why we also don't see 120 on here.
Correct. 120 is basically attached to 124 and operates in that as in a regional model.
Can I ask a question next? On the member fee chart, division budgets broken out by each UFA member, just so that I understand going forward. Tony, I thought this was a very interesting chart along the lines of what you were talking about, so that I could explain to my taxpayers just what they're getting. As a member of UFSA, is there a way for me to understand how to break that down by my, say, tax value or something like that?
Yeah, so that's a great question, and that's a UFSA question, and the UFSA has and can provide a breakdown of the UFA member fee to any of the entities that are interested in that, and we've done that for many, and willing to do that for any entity that's interested.
Okay, thanks.
Any other questions? I don't see any. I'll introduce now Kate Turnbaugh from the finance team. She's going to talk about the next section, the 911 emergency transport.
Thanks, Tony. Okay, let's get started. So the 911 emergency transport section starts on page 77 of the budget document, if you want to go there. We added this section last year to provide more background on the ambulance program because it is our second largest revenue source. Sorry. The staffing this year, beginning July 1st, includes 6 24-hour ambulances that are staffed with a full-time paramedic and a full-time firefighter EMT, 3 24-hour ambulances with a full-time paramedic and a part-time EMT, as well as 5 12-hour peak load ambulances that are staffed with part-time paramedic and EMTs. This staffing includes the conversion of 3 ambulance seats from part-time to full-time as part of the board's 3-year plan, and converting all of the 24-hour ambulances to full-time staffing increases our capacity for any type of event, not just a medical event. If you'll turn to page 81 of the PDF, I'm going to try to share my screen with you. So we can take a look at it. Can everybody see that pie chart? Yes?
Yeah, I can see it.
Okay, okay.
Yeah.
So you'll notice that our payer mix is made up of 5 different types of payers. We have our fixed payers that are kind of down on the bottom right side of the circle. That's Medicaid, Medicare, and veterans. These are government agencies that pay the amount that they allow to us, and we essentially can't balance bill the patient, except for some that have additional supplemental Medicare plans. Otherwise, we're left with what that agency pays for an ambulance transport. On the top left section of the pie chart, you'll notice our non-fixed payers. That's private insurance and self-pay. So private insured are our largest percentage of incidents and also the highest collection rate. Self-pay is our lowest collection rate, and those account for 14% of our incidents. We don't report ambulance as an enterprise fund like some other agencies do. It's just considered a program within the general fund. And like I mentioned before, transport fees are our 2nd largest revenue source, but the costs for the program do outweigh collections. So if we turn to page 82 of the PDF, let me get there. That outlines our projected revenues and expenditures for the program. You'll notice that the major costs for the program are $7.2 million for staffing, $388,000 to our billing service provider, which is Gold Cross, and that's based on just a percentage of the amount collected. $521,000 in vehicle and equipment maintenance, which includes medical supplies, and $400,000 for the state Medicaid assessment. That's the assessment that's paid by any transporting agency to the state, and it's based on call volume to help fund the Medicaid program to allow us to have it supplemented by federal funds. So that's all I've got with that. Are there any questions about ambulance? Yep.
Myself, can you review the relationship between Gold Cross and UFA? It's in the contract line in what you just showed us, and there are it's mentioned up above in terms of a 2008 agreement, but that predates my participation with the UFA quite a bit. So I'd really appreciate just a couple sentences on that issue.
Yeah, no problem. So we started with Gold Cross in July 1st of 2009, I believe, with our billing. And we used them for 3 years and then went back out to bid and selected them again. And at that point, we did a 10-year contract. So we're most of the way through our 2nd 10-year agreement with them. And we pay them, as I mentioned, a percentage of the collections that they make for us. And they do the billings. They provide, make sure that we're compliant with our reporting billing for Medicare, Medicaid, and all of the insurances, as well as collections and pre-collect services. Are there any other questions? Did I address your question? Okay. But they were selected because the rate that they were charging us was the lowest. And we liked that they were local as well. Okay, seeing None? Thank you. I'll introduce, who's next? Sorry, Chief Peterson, if you go over the Office of the Fire Chief section.
So there's two pieces of the fire chief budget: information outreach and emergency management. And I'll move straight into Niall Easton, who can move us through the information outreach budget.
All right, thank you, and good morning. So we're on page 76 now. Information Outreach Division is basically tasked with making sure communications is happening with our communities, staffing and managing your more than 200 community events and over 1,000 station visits last year. And then we also manage communications with our own people and media relations, social media, our website, things like that. In our budget, I want to call your attention to a couple key elements. If you'll go to page 79, one of the big things we're looking at this year, in fact, we looked a little bit at it last year and wanted to see how it built up the need for this conversion of a part-time to a full-time conversion over the last year. And the need has only grown exponentially. So we want to convert that position from part-time to full-time and have it focus on particularly connecting us with your communities in several different ways. Primarily, it'll help with the liaison program, provide support for that program, help with the quarterly reports. We want to get to the point where we're customizing those reports per your community, because each community has a little different feel that they want to see in those reports. This position would help support doing that. In addition to that, as you recall, last year we relaunched and redesigned our website, and we have a full year's worth of data. And just to give you an idea, we went from averaging 3,800 visits a month to 23,000 a month. So clearly the new website is a better resource than it had been in the past. What we need is this position to help feed that beast. The web, I'm sure your people who manage your own city websites can tell you, it's a hungry beast. You've got to keep new content going, or else it just gets stale and people no longer find it a resource. So we want this person to focus on particularly the community web pages. These are pages we've set up for each of your cities and towns that basically each week or each month can post new content as to what your fire crews are doing in your community. So your citizens can see videos, pictures, even stories about what's happening in your community with those fire crews. And this person would help provide that content and keep tracking it and make sure the beast is being fed. And then in addition to that, they would help with the person who's already planning and helping with those 1,000 station visits and 200 community events. Now, another thing we had done right below that was, and we started planning this in January, February, of course, and events that have taken a nosedive in your cities, as you well know. But we had planned to ask for a part-time event coordinator. This position would help with the logistics of towing the trailers all over the valley. We have the Engine 911, we have multiple trailers, and it has become very cumbersome for our PIOs to try to get those all over the valley. We have days where we'll have 3 or 4 events in the same day. The same equipment needs to get to all those events. But the events have just plummeted off a cliff this summer already. We thought they may come back, after July, but it's looking like probably not. So this is one that can be considered for postponing at least till the next fiscal year. The other thing to call your attention to was, if you go now to page 80, line 207, our non-personnel expenses, we've actually reduced by a couple $1,000s from last year, but we transferred in $45,000. You'll see the $40,000 there in 207. And then there's another $5,000 down in line 260 for retirement parties and ceremonies. This money is for graduations, promotions, award ceremonies, retirements. And then the big ticket item is the annual banquet for $25,000. This is something else that we think we could possibly consider putting on a hiatus for this next year. It is a large gathering of people. And then reevaluating whether there's a better way that we can, there's value in having our people gather because they just don't get to cross platoons very often and see each other. Whether the banquet is the best way or not, we propose, let's postpone it a year, reevaluate, and then come back with a battle plan for that in the next year that maybe can save some money off that. That's basically the highlights. If you have any questions, let me know.
Hey, Niall, this is Sheldon. Maybe at another point we can touch base, but there may be some ideas or options even with some of the stuff that we have in Riverton that maybe could facilitate an event that helps people gather.
That would be great. And that's what we want to, that's exactly what we've been thinking about is there a better venue? Is there better places that we can do this in a way that is not $25,000? That's why we think give us some time to kind of reevaluate and go in and research with your communities where we can do that. Thank you.
Quick question, Niall.
Yeah.
Was that the budget item for the awards and banquets? Was that accounted for in a separate budget before? It's just transferred.
Yes, that was in the administration budget before. Okay. But our division has been tasked with overseeing all those, so we felt it was a natural fit to just move the money into the IO budget.
Okay, thank you.
Of course. Okay, with no further questions, I will toss the budget torch to Chief Clint Meekum of EM.
So just before Clint jumps in, this is where I'll want Tony to ask if there's anything you want to add to the deliberation. Like if you want to go ahead and accept some of his recommendations relating to the seasonal coordinator or any parts of the budget. So we'll kind of, for all of the divisions, just remember to punt it to Tony before it goes on to the next division.
Okay.
So question for Tony then, is he then tracking on a spreadsheet, as you said at the beginning, some of those unique recommendations that we can kind of summarize at the end and look at them all? Or
yeah. What we'd like to have happen, what we'd like to have is that you just ask Tony to add whatever you want to a deliberation list. It doesn't mean you're approving or denying it yet, but then you'll have a nice spreadsheet at the very end that you can then walk through and consider everything that you want to talk about. So he's made a couple recommendations. Just I'd like to hear you validate you want Tony to add those to the list.
I'm going to support the recommendation of evaluating the $25,000 for the banquet. I know in our city, in most cities of all the mayors have met, all such gatherings have been, put on hold. Again, not forever, but at least in the immediate near future. So I'd appreciate this, putting that on the list for consideration at the end of the meeting.
And I would support putting the event coordinator position, as Niall suggested, on deferring that, or at least considering deferring that.
I agree.
I agree with both of those, and I also think that having an outreach coordinator that makes the web pages of each community more robust may be a way to reach people better in these times than since we're not doing these other things, that may become even more important. So I think that's a good idea. So basically all of his recommendations I support. And I hate to see the banquet go, because I actually think, that is a cool thing and an important thing department wide. But I think that Niall's right, that this next year is probably still going to be too soon to have a gathering of that size. And, and there's a leadership role that we have to keep an eye on with respect to that too, in terms of setting an example for other segments of our society. So,
thank you.
Did I capture the conversation right? There were two items then to add to the list: the banquet and the part-time events coordinator. Okay.
Okay, now I'll pass the torch to Chief Clint Meekum.
a man of many roles right now, huh?
Everybody. I appreciate the opportunity to come in front of you today and present our budget. It's been a very, very boring 2 months. No, just kidding. It's been a little exciting here. So again, I appreciate the time that you guys have that everyone has to hear about the budget. So the Salt Lake County Emergency Management Division is a division that is unique to Unified Fire Authority, as you all well know. It falls under a 50-year agreement that was created between Salt Lake County and Unified Fire Authority in 2004, and provides Unified Fire will provide the emergency management function for Salt Lake County for 50 years. So as a result of this, all of the funding that comes to the Emergency Management Division either comes from the county's general fund or through grants. Currently, we are looking for, in this proposed budget for 2021, of increasing our budget from last year, or the fee that we charge to Salt Lake County's general fund from last year to this year, by about $72,300, and that is just to keep align the budgets and the salaries and benefits for the personnel in the Emergency Management Division. Additionally, some highlights that we're doing this year: we've taken a position that was an operations specialist, and have tentatively upgraded that to a logistics unit leader position. Logistics is one of the areas that we have found to be very, very important these last 2 months, and we need to dedicate some specialized person to dealing with that particular piece of emergency management. Additionally, this year will be the year that the Complex Coordinated Terrorist Attack Grant ends, the performance period ends, and so the intelligence specialist that has been funded for the last 3 years through this program, we've also absorbed into the budget. And again, the only thing that we've asked from the county is that extra $72,300. The other thing that I would like to highlight and that I will mention that is somewhat unique is that we also have 2 emergency management, municipal emergency management specialists working with the Emergency Management Division. These are unique in that emergency management provides the support and the guidance for these positions, but these UFA employees are completely funded through a fee that only the participating agents, the participating municipalities pay to UFA. So they are fully funded by that fee. So again, there's no impact to the overall general UFA budget other than capturing those revenues and those expenditures going out that are budget neutral. And there's no budget to the county general fund fee that we charge to Salt Lake County. Those are the highlights of our budget for this year. The next thing that I will mention is that Salt Lake County has asked, because of the potential, or not the potential, the impact to revenue for Salt Lake County because of COVID and what's happened the last couple of months, for us to be prepared to take up to a 10% budget reduction. So on page 85 of your packet, we have gone through our budget and we have identified those things that will take us up to that 10% factor. And while it will reduce some of the things that we can do and some of the capabilities that we can have, we can absorb these in a manner that will not affect our basic mission readiness and our ability to continue to deal with COVID, as we anticipate that will go on for a number of months still. So those are the highlights of the emergency management budget at this time. I won't take any more of your time by listening to me prattle. I would be happy to entertain any questions that anybody might have.
Chief Meekum, a question that comes to me immediately is, it's interesting that they're asking for a reduction or proposing reduction from the county, when right now with the pandemic, the efforts and requirements are probably even greater of your division. Does the federal support, stimulus, CARES Act, provide any support to the increased responsibility put on you and your staff?
Yes, sir. So the CARES Act, and I heard you folks asking about CARES, there was $203 million deposited into Salt Lake County's accounts about a week ago. That's the CARES Stimulus Act money. That money will actually pay for my staff's and mine overtime, and then any additional staff that have been repurposed, their salary, their overtime, their benefits, and their backfill. So while we are being asked, as every other division within Salt Lake County is being asked, to take a potential 10% reduction, we do have those supplemental funds coming in that are paying for those reassigned, retasked personnel to help us maintain the staffing during the COVID crisis, sir.
And let me speak a little to the county's approach too, is that this is Mayor Wilson has done a stress test at the county level, is how she calls it. And they're doing another 10% stress test. It doesn't mean what's going to end up actually happening. It could be zero, it could be a portion or therefore. And I think from their perspective, they don't want to leave anybody out of the fun involved in a stress test. So what they end up with, that'll depend on what the council and the mayor does. But it's no different than, you could argue that the stress test that we put on our divisions starts that way, but then ends up more focused on what you're describing, Mayor, and that's what's the best thing to do with the money, not necessarily an across the board cut.
Right.
Chief Meekum, what does an earthquake do to your budget?
So overall, Mayor, we've spent about $970,000 countywide on the earthquake response. That has been a fairly static number for the last couple of weeks. We hit that number about 4 days after the earthquake response. We've added a touch to it because of damage assessment crews and that sort of thing. Again, because of the amounts of damage, it took us a while to compile all of that data. That data has now been pushed along to the state. The governor's office is considering a major disaster declaration for the quake now as well. If we get a major disaster declaration for the earthquake, it will open up additional what PA monies or public assistance monies, probably to the tune of a 25-75 match. And so that money will go to help replenish the county's general fund for the monies that we've spent on the earthquake response. And then we're working with Salt Lake County leadership on the remaining 25%. So that's where we are with that, sir. Any other questions? Yes, sir.
Question. Can you address on page 96, the computer software increase from about 9,000 to about 200,000?
Yes, absolutely, sir. And I was expecting that. Basically, all of the software, this isn't a gigantic increase, though it may look like it. Before, in years past, the software was spread amongst various other line items in the budget. This year, working with the finance division, we've decided to try and consolidate all of that so it's not spread out all in one place. So what you're actually seeing, while there is a small increase for one piece of software, most of those other costs were already in the previous budget. It's just been reconsolidated into one line item, hence the gigantic increase look on that line item.
Okay. Thank you.
Yes, sir. Any other questions I might be able to answer?
Seeing none, Clint,
none?
I'll ask the board if there's any items you'd like to add to the deliberation list from EM, keeping in mind what Chief Meekum said. Any changes here won't impact your member fee.
Yeah. Did I mention we're funded from the general fund, right? Yeah, exactly.
Okay. Seeing none, and I'll just speak quickly to Councilmember Perry's question. You'll see that software thing throughout all of the budgets where we've tried to align the computer software better and capture everything inside of that GL line. And so most of the divisions will see an increase, but it's most of the time it's just movement inside of the budget. So with that being said, we'll next turn to our administration and planning division and turn the time over to Assistant Chief Riley Pilgrim.
Good morning. I'm excited to be able to present this budget to you. And as many as you know, when the year began, I was actually preparing to present the support services budget. And with the announcement of Chief Solkowski retiring, I made the decision to pursue that position in administration and planning. So I'm pretty excited to take on this new role. It's definitely a little bit different than where I was in support services, but it's going to be a great challenge and a great opportunity. So to kind of outline what admin and planning covers for the organization, we have the general administration of the fire department, which is support, leadership, counsel to all their sections within UFA. Human resources is within this section, as well as our safety and risk management, which you'll see some significant changes with that this year with our behavior health and wellness. And then we also manage and oversee all the committees and work groups such as strategic planning, professional development, and policy review, and our governmental relations and liaison program, which are extremely valuable to organization in each of your communities. So some of our top priorities for the administrative section this upcoming year are kind of continuations of what we've been doing. First and foremost is transparency, as you see what we're presenting today with the budget and the numbers and our dedication to providing you with the best product possible. We want to be as transparent and as open as possible with our information and what we're doing with the funds that we're given from the taxpayers. Our next big priority is our health and wellness of our members, both mental and physical. And you'll see that's kind of some of the biggest changes that have occurred within this this budget this year. Strategic planning is also going to be a big one. We're moving into the drafting of our next strategic plan for 2021 to 2023. Chief Sokowski did an amazing job administering the previous plan, and it really did lead to some positive organizational changes that we're seeing today. The benefits have been great. And then leadership development for our department. We know this is an extremely important thing that we need to do as far as preparing all of our people to move into every position we have, whether it's a captain, battalion chief, or these positions as assistant and the fire chief. We want to make sure we have that leadership training in place. So that being said, a few items that I would like to call attention to, just as they are some of the most significant changes, is first and foremost is we did have a transfer of a position from our medical division into administration and planning, and that will be for our new behavior health and wellness officer. We did select Captain Lane Hilton as the person to kind of fill this position. He was the only person who put in, but he has some very unique qualifications and experiences that suit him well for this position, especially in his time spent with supporting law enforcement as a paramedic SWAT officer, and within our own department, working with our own members who've had different challenges that have come up in life, especially dealing with mental health. He's trusted. He's an advocate for both organization and employee, and he's done some amazing things. While he was in medical, he was also multitasking and functioning as our medical training officer and fulfilling both of these roles. And so, kind of in an effort to streamline the budget, not add any new positions, we worked with medical, and we decided it would be best to just transfer this position from there to admin and planning. And so this isn't a new increase. This is just simply a transfer from one division to this section, which we feel like is a great fit and will help further our efforts in providing that health and wellness support to our members. The big one that came up that the chief mentioned before is our liability insurance. We had originally forecasted and anticipated about a $71,000 increase. And literally as of last week, probably about 6 days ago, they informed us that there's actually another $25,000 increase on top of what we had forecasted. We are currently in the process of researching a few options and working with the company. We believe this will be the best rate they can give us at this time. Speaking with the chief and with our attorney, I would anticipate and expect this to be forthcoming on the next board meeting agenda. This is a pretty significant increase. It's an important thing that we need to address. Captain Greensides, our safety officer, has been pursuing other options and looking at what's out there, but that's something that will need to be further discussed amongst our board members, the chief, and the attorney.
Really quick, Riley, did they give a reason for the increase?
Brian, I'll kick this one to Brian for a minute. He has some of the details that I don't have fully understood, so I'll share that with him.
Sure. It was just more a rate revision, and that we've had fairly high claims recently. So it was just a typical, insurance company rate analysis. Nothing specific, but just that we were a quote unquote bad bet.
Okay.
Yeah, and internally we've done a lot to hopefully improve that bet, improve the odds on our side as far as driver training and awareness of our members as far as what injuries and different things can do, both personally and on the workplace, work site injuries. So that's something we're also looking at internally to hopefully become like I say, a better bet. So it's difficult with what we do.
And some of it doesn't have anything to do with us. Like we have an uninsured motorist claim that right now that's pretty significant or could potentially be significant, and that's not our fault. It's another driver not having adequate insurance. So stuff like that happens.
Yeah, a wide variety of issues that make that a little more challenging. So another increase that kind of is a little bit bigger than usual is our 410 account, so our small equipment. In an effort to support our upcoming physical fitness standard, we do need to acquire some equipment to better prepare our members to take that test and to be assessed. And so you'll see an increase there to provide that equipment to certain areas within our department so we can get our members involved with some different testing mechanisms and to be more prepared for that. Travel is another increase, and we've looked at this one closely, especially with the way travel has changed over the last few months. The big increase there is primarily to our outside observers and raters when we do promotional processes, leaders and leadership training that we bring in to provide kind of some really unique training that's valuable to our organization. And then our municipal emergency managers have some training demands. We are looking at different options like what we're doing now, Zoom calls, and having some of our raters participate over Zoom, especially with our promotional exams. But even personally, I can't underestimate the value in having those people here on site, the networking we're able to do, and kind of that socializing that we're able to participate in and accomplish when we can bring them here has just been extremely, it's invaluable. Personally, I benefit from that, working and meeting other chief officers that I can sit down with and pick their brains and get a feel for what they've gone through and bounce ideas off of them. That's hard to replicate over Zoom and over WebEx and over these different mediums, but having them here in person, the value just can't be understated. So that's something we would like to continue to pursue. It's added a great level of confidence in our promotional processes. And again, a lot of the solutions we're finding to the challenges we see here at UFA are coming from other organizations and their experiences and our ability to connect with them. And so that's something that we feel is extremely valuable, and then we would like to see continue. And then to kind of help with this, we've also looked at some positions, and we've opted to eliminate one of our proposed admin assistant spots. With the staff we have internally and with the jobs we do as assistant chiefs and administration, we feel like we can cover that with what we have on. And so that represents about a $75,000 savings. So those are kind of the big highlights of the admin and planning budget. I don't know if you have any other more specific questions for myself. I'd be happy to answer any of those.
I've got a couple questions for you, Chief. One thing I would say is, well, I'm just a little confused. The liability insurance at $544,000 in this budget, if you look to the left on the budget sheet, what is that, page 113? Maybe I missed what you pointed out, but we had zero in the budget in past years. So is this just moving over from another category?
And I failed to mention that with one of our transfers as well. So that used to be in the finance budget. And they just transferred that over to admin. So that cost, as well as tuition reimbursement coming from HR to admin, you'll see that increase. And then the allocation for that health and wellness coordinator.
Okay.
Mayor Sondak, we had $472,500 in the budget last year for liability insurance.
Oh, okay. Thanks.
Yeah.
So I was just a little confused about the scope of the increase we were talking about. And then I would say that travel and transportation, at least in my work, we would separate some of what you were talking about as travel, bringing in an expert trainer and put that into the education and training line, just because that would be the purpose of the travel. Travel is usually our own travel, sometimes for the purpose of at training. But so I'd point that out. And then the other thing I'd say is that at the university, we are being told the decision hasn't been made quite yet, but we're probably going to start our fall semester online. And I, as a department chair at the university, am certainly not planning to bring any speakers to campus in the fall, which we normally have one a month. So that might be an area where at least for 6 months you can lower some of your expected costs. And then finally, I have a question back on page 105. At the top of that page, there's a mention of working with the town of Brighton to address the potential impact of losing the recreational contribution from the county by June 2021. Is that just being careful, or have we received notice that that's going away too?
That's being careful, being aware. You know, I think that's still a fluid conversation that is a little more solidified with the recreational area being defined and including Brighton, but it doesn't still eliminate the fact that the county has the option to make adjustments and changes in that.
Okay, thanks.
And I might speak just briefly related to travel. We actually intentionally consolidated all of our travel work into one space after the audit. So all travel in, out, bringing in, etc. We have a travel coordinator and a travel auditor so that we never have the problem that was here prior to that, right? So it's embedded in that space, and I've been pushing us away from attending as many conferences and more into either site visits or bringing in people, not only for promotional evaluations, but if I bring 2 or 3 chief officers from around the country to help with a chief officer selection, I will often hold them over for a leadership discussion at the same time and then maximize that time. I think we're spending a lot less than we would on a conference, and we're gaining a significant value when I can put 30 people of leaders in a room to speak. But really the purpose was to make sure that all travel is now out of administration and has a coordinator. And we had challenges previously where people were making, well, if you read the audit, you'll see a number of issues that we were correcting and stopping from happening. So that's the purpose behind centralizing that number.
So Chief, do you support, though, with the pandemic and the challenge across the country of still increasing travel by the 20%?
I think it'd be reasonable to reduce that. You know, that was another pre-COVID plan to make sure that we were effectively set. What do you think, Riley? If we end up with, you know, the first 3 to 6 months of significantly reduced travel, what do you think that would be? What do you think a good target number would be to put in the deliberation page?
Yeah, I think we're definitely open to that one. That's something we've discussed internally. You know, we could probably, a lot of our training, you know, we try to schedule that out. As far as what the fall goes for, we do have our captain's promotional exam, which will probably have some Raiders participating in that. And a lot of that may be over Zoom, as we're doing right now. That's a little bit harder because of the volume of captains we'll have, or potential captain candidates participating. That's one of we'll probably have to evaluate as we get closer and see what the climate is as far as travel goes. But we could probably consider dropping that well over maybe, you know, a quarter to a third, if not more, if we want to be a little more aggressive. But I think because the next 4 to 6 months are hard to predict, that might be a safe bet, is to drop that at least consider a third of it. So you could probably save
a third is $47,000.
Yeah. Or I mean, a third of the increase, so we're looking at $25,000 for the extra ask.
I think if we go 3 to 6 months with almost no travel, I don't think I'd have trouble with saying let's throw a $40,000 cut to that line item.
I'd put that on Tony's list for consideration.
Yeah. Why don't we start with a $40,000 cut to that line item, and then we can talk more about it in deliberation. And the only concern I'll have is that if we return back to normal, like his comments are pretty accurate, and we may want to bring that back in future years. But for now, I don't see a challenge in that.
Okay, I'll add that. Are there any other items from the administration budget you'd like me to add to the deliberation worksheet? Okay, seeing none, we'll turn the time over now to our HR director, Ann Wolf.
Thanks, Tony. Hello, everyone. I will just go through a couple quick things. Human resources, as you can probably expect, just assists our managers and supervisors with a lot of different functions within HR. So what we're focusing on is compensation, benefits administration, the new hire and the promotional processes, our employee relations area, dealing with assisting with workers' comp injuries, and dealing with our safety officer and helping people return back to work when they've been ill or injured, managing leave while they're off. Those are kind of the highlights of what we focus on, as well as assisting administration and planning with leadership and development training, other kinds of employee training, the performance appraisal system, and then the tuition assistance. So we kind of do a joint function crossover there. Just within the budget, a couple of things that I wanted to point out is that we were looking at an increased cost to our medical services and drug testing for our physicals, because we were hiring. We've had trouble keeping our part-time employees staffed. That's a difficult group to recruit for and to keep retained, but we have hired more than we had anticipated. So we were looking at about a $15,000 cost increase just to run through the additional employees that we were going to hire full-time and part-time through our new hire physical and drug testing. But in evaluating that and going through it and kind of carrying forward what we started last year with the stress test that Chief mentioned, we identified more within the part-time physicals that we could eliminate, that we didn't really need to have them do as part of their pre-hire. We verified it with our safety officer and worked through with our medical provider to do that. And so we were able to absorb that cost in the medical services line item, so we didn't have to increase there, even though we're doing more testing for our full-time positions than we were previously. And then second, there's kind of a large jump, as I'm sure you noticed, in our education, training, and cert line item, the 1092-250. Just wanted to touch on that a little bit so that you would see the why. We are working, when we do our professional development and the trainings that we attend, we try to do that on a rotating basis, so every other year for the staff that's in HR. And so this year would be one of the years that we had identified to attend an HR conference. And then also with our HRIS system, Kronos, they hold a conference that's very beneficial as far as administration. Both of those I do not know. They would probably be in the fall, and I don't know that that's going to happen. So right now they're identified. It's late November, so I'm just not sure, but it's also in Vegas, the Kronos conference. So but the other conference could be in the spring. So those two we identified. And then there's also a couple of other items we identified as a project. One, that in Human Resources Deputy Director is going to be getting his either SHRM or SHRM SCP or the SPHR designation, which is strategic planning, and from an HR perspective to just increase proficiency and skills at a different level. And he's going to go through that process, which is a course as well as an exam. So that's identified there. And then we've also need to convert to a digital version of our sexual harassment training for new hires. We're also looking at providing additional drug and alcohol training to our employees and our supervisors as part of the behavioral health and wellness program. And so those are to purchase digital training materials in that arena. So that was the increase there. And then the one other area that jumped a lot was food provisions. And just wanted to clarify that that's not necessarily a transfer from other divisions, but it's a consolidation. So in previous years, we would budget for the large promotional examinations. We hold the raters on site. It's just much easier to do that as we go through our processes. And so we would budget for the large processes, the captain exam, the battalion chief exam, all of our new hire processes. But individual divisions, if they were going through a process to select, say, a mechanic or a new fleet manager or another position like that, they would budget for that and cover the cost of food there. We were able to track it really well this year. We were able to set limits. We were able to kind of use ongoing same providers and keep those costs controlled. So we just decided this year would be more effective if all of those processes just came from HR and we just continued the process we use for the big processes there. So it's an increase, but organizationally, it's not an increase. It's just an increase within the budget. And then do you have additional questions for me on other areas?
Okay, seeing no questions, is there any items from the HR budget you'd like to have me include on the deliberation spreadsheet?
Right. The comment is the overall budget actually is a reduction from the prior year. Is that right?
Yes.
Okay.
No, well, would just correct that. If you look at the page, I think, Ari, if I'm not mistaken, if you look at page 121, it's actually a 2.6% increase. Is that accurate, Tony?
Yeah, because of the transfer out of the tuition program.
Okay.
So the 5.2 is, yeah, it budget to budget, it's a reduction. But if you take into account the tuition being transferred to admin, they do have a slight increase.
Okay.
So one of the things that we made sure and add here was partly from last year, Councilman Stewart actually helped with this, that at the bottom of every one of these spreadsheets is the net effect. There is a capture in the finance message, but the very last line is the net impact, and that's when you straighten out all transfers to give you
the
a
2.6
reality check. So it's a 2.6% increase.
Yeah, I see that. Thank you.
Okay, well, we'll slide in now and we'll move to the finance division budget. So we will be on page 123 of the budget document as you follow along. So the finance division, quick overview, we're responsible for providing all the financial management for the UFA. That includes the budget development, our financial reporting, our accounts payable, accounts receivable, payroll. We manage and administer the purchasing card program. We do all the treasury management, etc. We also, because of the new position that the board added to our division last year, the new purchasing agent, which has been a great addition to our budget. We've been able to streamline our contract administration and our purchasing, and so that's been a great add to have that be part of the finance division too. But really, if you flip over to page 129, you can see the full ask for the budget for finance. There's really not a lot of additions. I'll start in the revenue section. The second line there's the contribution from the UFSA for the work that's provided by UFA employees. So that's a revenue to UFA. You'll see that in the finance division, the administration division, and also logistics. We reviewed that. The committee asked us to review that, the percentages that are being charged to each of the employees' time. We've reviewed that and feel comfortable that what the board approved back in November is still good. And so those revenues that you see there align with those percentages as approved a few months ago. As you work your way down our personnel, we actually have a slight reduction in our personnel. In our finance non-personnel, we are increasing by 5.2%. That's about a $2,600 increase. All of that increase is really one ask of the board. We're asking for $3,000 for some data collection software. The UFA was selected by the Medicare program to participate in a program to track all of our costs related to our 911 transport, which we'll submit to the Medicare office to help them understand if the rates that they're charging are correct, if they're high, if they're low. And so that will be actually quite a undertaking for us. We have a big program, and so we're asking for $3,000 for some software to help us with that process. Work your way down into the UFA operational section. Again, it looks like we're down a huge amount, but that is a lot to do with the transfer of the insurance over to administration. We do have some increases in our professional fees with our ambulance billing software, and then also our ambulance billing company, and then also on our Medicaid assessment line. Those lines always just kind of track with our ambulance revenue. So as we pick up more revenue, our expenditures go along with it. Then the last piece, the debt service line, that's actually down a little bit. That's no real change in the debt service payment, but the board transferred 3 engines over to our wildland fund a few months ago. And because of that transfer, the wildland fund's picking up a little more debt service, which is caused a little bit of a relief there for the general fund on debt service payments. So there you go. That's the finance division budget. I'm not exactly sure what happened, but the net number didn't make it on this. Our net number is actually a 1.1% reduction when you include, not the 11.5. So we're down 1.1%. Again, happy to help with any questions, or happy to add any items from the finance division budget to the deliberation spreadsheet if there are any.
I was going to crack a joke, Tony, that we should put the CFO's line on. Just kidding.
Yeah, that would be fun, I'm sure. Okay.
What was the big award you got? How much was that worth?
Well, no dollars, but hopefully some good value. Okay, seeing no questions or anything to add to the list, happy now to introduce our emergency services assistant chief, Assistant Chief Higgs, and he'll take us through emergency operations.
Hey, thank you, Tony. Everybody hear me okay? Okay, great. Great. Well, I'd like to take you through the operations budget here quickly, just touch on a few items to highlight. Obviously, we're talking about the members, your members who staff all of the engines, trucks, ambulances, and the battalions each day. In the budget, as has been discussed already, you'll see that we've made a significant restructure with the elimination of the district chiefs and the creation of an operations chief. That change does provide some significant savings in the budget. In the budget, you'll also see 9 new firefighter positions. These 9 positions completes our conversion of the 24-hour ambulances so that there will no longer be EMS only part-time on those ambulances, and this helps us to realize the full value and potential of that conversion that we started here 2 budget cycles ago, so this will be the final one. You'll also see a recommendation in the part-time EMS related to part-time paramedics. We are having real difficulty attracting and retaining part-time paramedics. And we are in a survey that we conducted to see, where the competition was, where are we losing these trained paramedics to. In the marketplace, the clinics and the hospitals are paying significantly more per hour for part-time paramedics. And so we're recommending that we increase the hourly rate for part-time paramedics from $18 an hour to $25 an hour. This is a significant increase that we're asking for to do that, but we're very hopeful that this will help us to not only attract but also retain those part-time paramedics. Those medics will be staffing the peak load ambulances. They won't be on the 24-hour ambulances. You'll also see in the budget an increase in our minimum staffing overtime of $700,000. We're just completing the third year of trying to maintain that target, that minimum staffing target. We've learned a lot over the years, and we feel that this adjustment gets us closer to where we need to be. We've been able to make the target each year primarily due to vacancy savings, but we feel like this gets us to a more accurate number. We've had great success too with the overhire, and are looking with this class that'll be coming out here the end of May into operations. We think we'll have some success with that, where we can keep positions full for a little longer through the year before we start to go down due to retirements. And then the last thing I would call your attention to is we are proposing an upgrade to 3 firefighter positions to wildland specialist. This is really being done to provide sustainability in that program. And when Chief Burchett comes on, I'll let him talk in more detail to that, and he can help answer questions on that. But those are the areas that I would like to highlight this morning with you. Any questions that I can answer?
Maybe you touched on it and I missed it, but the grant expenditures, that 40,000.
I'm not sure what you're speaking to, Mayor.
Okay,
I can jump in. So we have a
Okay.
SHSP grant for $40,000. It was awarded through the State Homeland Security Program, and it's going to help us with some RTF equipment.
Yeah.
So is that an expense or
Yeah, there's 40,000 in the expense, but if you look in the revenue, you can see $40,000 in grant revenue as well.
I didn't see the revenue side. Thank you.
Where are we on the VEC situation? Because I can see that there's a 12% increase or 11% increase here, 12%.
Yeah, I think I'll let Chief Peterson jump in on that. He's got stronger background.
Yeah.
That just affect all the cities too, yeah.
Yeah, so VEC, for the first time in a very long time, we have an actual budget, a quality budget that's being presented by the new director. We have found significant problems in the VEC system. There was a lot of money that was money streams that were spent twice. We actually had to return $177,000 back to the state because it was accounted for in 2 separate grants as expenditures by the previous administration. We have sorted through, and all of your, many of your city managers are with me on that board of trustees. We learned how off we were in the budget and how the ending fund balances had been chewed up, how money had been spent twice, a lot of challenges. But about 2 months ago, we came to a really good sit-down meeting and agreed to a 12% increase. UPD, however, had been cost-centered and was being way overcharged for their effort. They received a slight discount, and we basically told them, you build a budget around that. We're not going to be able to afford what you want completely. But he's been going through and finding savings pretty significantly. He's let go of a couple of key staff. He's restructured his administration, and he's intending to meet that target completely. We're still 6 to 8 months away, though, from transitioning to a more effective organization. I am absolutely confident, though, that what he's done already our operations BCs are seeing the value. As if you talk to your city managers, I think you'll find they're frustrated with some of the things they're learning, but they're beginning to trust the VEC administration for the first time in a very long time. Is that fair for those of you that have talked to your city managers?
It is more than fair. We had Mr. Roth come to our city council via Zoom this last week, and actually I'm impressed with his evaluation and what he's seen and the actions he's taking. So I think you're on the right path.
Yeah, I would say that we got the same report back from our acting city manager right now. So,
yeah, and I'm serving as the chair the next 2 years, and my goal is to make sure that he's got the support he needs to do, and that we as a group make the tough decisions and allow him you gave me a significant flexibility here to fix the problems here that we've been able to get through, and he's getting that same opportunity to fix the challenges there. And for those of you like Steve that have been around for a long time watching VEC, there is hope in VEC that maybe hasn't been there in 20+ years.
Agreed.
Okay,
But
any
we're
other?
not done. We're not done with the pain yet.
Sorry, Chief. Any other questions for emergency operations or any items that you'd like me to put on our deliberation worksheet? Oh, Mayor Peterson?
Well, no, I'm just going to say it. When you look at the 47 million in, we have to trust that the vetting that's already taken place internally is been efficient and looking for any discretionary money. So I don't really have a question yet.
Perfect. Thank you. Okay, seeing none, we'll move to our next division, Special Operations, and we'll invite our Division Chief, Brian Case, to join us.
Thanks, Tony. Good morning, all. I'll be reporting to you today as part of this budget process on 2 sections. The first section I'll be reporting on is Special Operations. I am, as Tony introduced, the Special Operations Division Chief. Again, my name is Brian Case. I'm happy to report to you that the Special Operations budget this year is flat as compared to next year with no increase. In order to orient you, the PDF page to start from is 152. The document will run from pages 144 through 150 for your reference. Special operations within Unified Fire is speaking to our hazmat programs, our heavy rescue program, and then also our water response capabilities. These are made up of the crews that are already working in the stations. They just happen to be stationed or positioned strategically around Unified Fire Authority's response areas. And these crews, above and beyond the typical expected training and certification levels, commit thousands of hours to develop these further subject matter expertise in these various capabilities. So what my position does within Special Operations is I manage the administrative functions such as budgets, policy, promotions, certifications, records management, things like that, as opposed to the operational aspects of the Special Operations side. Some of, excuse me, some of the things that this year's budget is going to accomplish with respect to Special Operations is we're going to enhance our already existing capabilities within these programs. To name a few things, we're going to enhance our ability to perform in structure collapse and heavy vehicle extrication as the time comes. And then we're also going to be able to better outfit our hazmat companies with a new weather station, which is pretty key when it comes to responding to events such as what we saw at Kennecott following the March 18th earthquake. So these crews really respond to, as I've mentioned, the technical things like the hazmat spills, structure collapse type of scenarios, technical rope rescues. These are the highly specialized crews that respond to these technical incidents. It's important to note too that there's a great appetite for more training within these sections, but we're leveraging state homeland security monies and also federal grants to hopefully find zero cost training opportunities to these crews within Unified Fire. What is new this year is training cadre expenses to the amount of $10,000. This is not necessarily new to UFA. These monies were accounted for last year in the emergency operations budget, generally speaking, but this year they're being carved out and more appropriately placed within special operations. So we have a better, more true sense of what the overall expense of special operations is. That is the summary that I'm able to offer to you. If there's any questions, I'm happy to entertain them now. Thank you.
Okay, any items from special operations for our deliberation spreadsheet? Okay, we'll move to our next division, our fire training division, and welcome in our division chief, Matt Rhodes.
Good morning, and I'm happy to be here and present the budget to you. Just a brief overview of my division. We're responsible for training all members and keeping all certifications and standards up and to best practices along with all the state requirements in fire and rescue related areas. This begins with a recruit camp with all the new guys and getting them up to speed and getting all the knowledge, skills, and abilities where they need to be. And we're happy to announce they'll be graduating in about a week, 31 pretty eager people to get out in the field into the communities and start doing some work. Also responsible for providing all that training to all the current operational members to keep their skill sets up. This effort ensures that the communities have high functioning firefighters within each community. So to kind of jump into a couple of accomplishments from last year, we were able to capture an increase of about 19,329 indirect training hours to the department and over 375 direct from the previous year as far as training hours go. So a huge accomplishment. We're also heavily invested in the hiring process just to ensure that we do get the right people. This has been moving forward very successfully. We're seeing really good quality candidates come through, which is reassuring that we're doing the right things and moving in the right direction. So a couple of the larger changes to the budget this year that I'd like to touch on. So if you would go to page 158, I believe in the PDF. So you'll see under personnel, there was an increase of 21.8%. And what we did is we transferred $209,000 over from operations to my budget. What that's for is when I have a recruit camp, I bring out cadre instructors and resident experts to facilitate that recruit camp. And this just more accurately captures what the expense is. So instead of having it borrowed from operations, we just moved it into my budget. You'll notice on line item 305, 315, and 325, we got zeros in that proposed budget. That money was transferred into logistics so it can be better tracked. So instead of each division having their own maintenance, that just got lumped into logistics budget. Down on line item 424, you'll notice that there's a 450% increase. If you take a look at line item 503, there's a 100% decrease. Those two line items were very similar in nature, so we thought it would be easier to track and less cumbersome just to move those into one line item and kind of clean the budget up a little bit. But at the end of the day, we were able to do net 5.1% decrease in our budget and still increase training hours moving forward. So, but that kind of sums my budget up. I'd be happy to answer any questions if you have any. If not, I'll push it over to Tony.
Yeah, so seeing no questions, any items from fire training for our deliberations? Okay, we'll move into our next division, our EMS division, and welcome to the meeting, Division Chief Jay Torgerson.
Good morning, board members. Thanks for the opportunity to come and talk to you this morning about something I'm passionate about, and that's emergency medical services. So we are on page 167 on the PDF if you're following along. Just to give you a brief overview of what EMS division is responsible for, it's basically two areas. The first area is to ensure that the citizens and the visitors that you have in your communities receive the best patient care possible when they dial 911 for any kind of medical problem that they are having. The second focus of our division is to ensure that we're supporting our providers with their ability to provide that excellent patient care.
Hey Jay, you're coming in and out a little bit. Can you maybe get a little closer to your speakers?
You bet, I'm right there. Is that any better?
Yeah.
Okay. So the second area is just to ensure that we are supporting our EMS providers in every way possible so that when your community members call 911, they are able to respond and provide the service that your citizens are needing in their time of need. We do this in a few different ways. Number one, we continuously evaluate the service that's being provided to ensure that all of our paramedics and our EMTs are providing the service that is outlined by the rules that we follow in those services. And we also ensure that all of our providers receive the training that they need in order to maintain their EMS licensure within the state and nationally. So those are things that they're required to relicense every 2 years. They have to have a certain number of training hours in certain areas in order to maintain that licensure. A couple of the other areas that we focus on in the EMS division that you wouldn't normally think of are our biotech side. So those are the folks that are responsible for maintaining the hardware and software that enable us to capture reports when we are on medical calls. So we capture all of that information, and that gets sent over to our billing agency and allows us to send bills to patients that we respond on. They are also responsible for taking care of all of the devices, the electronic devices that we utilize during the patient care process. So our EKG monitors, our CPR devices, anything that's used to deliver patient care that's electronic, they manage that and make sure that they're all functioning correctly. One of the other areas that we focus on within the EMS division is making sure that we are tracking our controlled substances. So we track them from the time that they're purchased and that they come into UFA until the time that they are either administered to a patient or they expire and then they are destroyed. It's very important. That is an area that is important for us to make sure that it is done appropriately, that we're able to track that, and we have adequate record keeping so that every couple of years when the DEA comes in and audits us, we are ready and we have everything in order to answer any questions that they may have. A few of the changes that are significant for the EMS division within this budget cycle that I'll just review. The first one is an increase in our education and our training line item. So in order to transition from being an EMT to a paramedic, it takes about a year to do that. So it's nothing that can happen very quickly. We want to encourage our own employees and support our own employees in that process. And so we have allocated spots for 6 paramedics or 6 EMTs to attend paramedic school in this coming year. It's about $8,500 per student to send them through that process for a total of $51,000. We just sent out a memo to see who might be interested in doing that, and we've had significant interest, and so we're hoping to be able to send our own people rather than having to hire from outside. We'd like to support our own people in that process. The second increase is the recertification fees. So we, as I told you, we relicense our EMS certifications every 2 years, and that's a state and national process, and there's fees associated with that licensing process. Last year, the year that we're currently in, we had 177 of our members that needed to relicense. Next year, we will have 258, so an 81 person increase in the number of people that are due to relicense next year. So not everybody is due during the same calendar year. So more are due next year than were this year. So that's why we have the increase there. One of the areas that we're looking at decreasing is putting off the purchase of batteries for the coming year. We feel like the batteries that we have for our EKG monitors and our CPR devices are adequate. We feel okay. And so we're putting that purchase off for a year, with this, which would be a savings of about $30,000. So the big change to the EMS division for this year is a change in staffing. You heard the administrative division or assistant chief talk about the transition of a captain from EMS division to admin division for our mental health and wellness position. So that is a position that's coming from EMS. It was a captain that had previously worked in our division and is transferring over to the administrative division. So it's not a new position, it's just a transfer from one division into another. We were also asked to eliminate an additional position within the EMS division. Originally, we had thought about eliminating a captain, but after getting together with my team and doing some analysis on what made sense, we have changed our position there, and instead of eliminating a captain spot, we would prefer to eliminate a specialist spot. So it's one of our training specialists that we would prefer to eliminate rather than a captain. I can't do without having a captain within my division for some of the oversight that we do in many areas. So that will be something to consider at the end of this, is that difference in a captain's salary versus a specialist salary. So it's about a $14,000 difference that you would have to approve. With these changes, my division is going to have to become more streamlined. We're going to have to be more efficient in the way we deliver training. We want to ensure that all of our providers receive adequate opportunities to receive the training that they need to, first, to provide excellent service, and second, to maintain their licensure. This COVID situation has really forced us into having to be flexible in the way we deliver training, and I think it's going to help us with becoming more efficient. We've had to utilize some of these platforms that we're currently using. We've used Zoom to deliver training for the last couple of months to our field personnel, and it's worked really well. So it enables us to deliver training without taking units out of service, without having them drive to a headquarters building to receive that training. They can stay in their own stations and receive that training. And so it's really enabled us to become more efficient in what we do. I'm confident that with these changes that we'll be able to continue with providing that excellent care, and we'll be able to continue with supporting our personnel and providing that care. Any questions for me?
I have two for you, Chief. On the organizational chart on page 162, this is the structure you want, right, going forward? Am I understanding that correctly?
No, so that was the structure that we had initially proposed with the elimination of a captain. So that will need to be changed in the document. So we would be putting a captain back into that, and that captain would oversee 2 training specialists. So underneath Jeff Cunningham, at the very bottom of that is 1 training specialist. They would move over to the right as you're looking at it, and would move underneath a training captain that would have 2 training specialists underneath them.
Okay, I see. Thank you. And then another question about the relationship between our emergency services and Gold Cross. Much higher up in this document, there was a statement about the agreement with them about 911 calls versus non-911 calls. Can you speak something to, so this is an issue for my community in particular. So if it's better for us to talk about this separately, I'm happy to do that. But I'm just wondering about how that's reflected in the way you operate.
So I can just give you a brief answer of what we're licensed to respond to as an EMS agency. We are a 911 EMS service, so we respond to 911 calls. We are not licensed to do what's referred to as interfacility transports. So if say for example, there were a patient at the hospital in Riverton, and that patient needed to be transported from the Riverton Hospital to Intermountain Medical Center in Murray, that would be considered an interfacility transport. And the way that's looked at is the patient is in a hospital, they're being taken care of by a physician, by the staff there, and there's time that can be, a transport could be arranged to move them from the Riverton Hospital to the Intermountain Medical Center. That can be arranged, and that is facilitated by Gold Cross because there's time there. A 911 EMS service is when you want the quickest, most appropriate response to your emergency right now. You don't want to wait for any kind of arrangements to be made. So if you're having chest pain and you are at your home, you call 911 and you get the very closest station or the closest appropriate response to that so that they can respond within a matter of minutes rather than having to coordinate and manage that response. So that's the difference between an interfacility agency, which is Gold Cross, and a 911 agency, which is Unified Fire. Does that answer your question, Mayor?
Yeah, I think that's a good answer for now. And I just got some questions yesterday from one of our, from our clinic director, given some of our changes, and I'll just ask. I'll follow up with you separately.
Okay, thank you. Any other questions for me?
Okay, seeing none. Any other items to add to our deliberation spreadsheet? We will have the one for a $14,000 increase for the specialist versus captain. Any other items from EMS that you'd like to add? Okay, seeing none, we'll transition to our next division, our wildland division, and welcome to the meeting, Division Chief Burchett.
Hi, good morning. Thank you all. I'd like to first start on the wildland specialist portion that Chief Higgs brought up in his budget. Just want to make sure there's no questions that you have. If there's more information you need, I'm happy to answer it. But if you're comfortable with what is written in the budget, we can leave it at that. So start with that opportunity. Okay, so we'll go on to the division, the wildland division overview. That starts on page 170 in your budget document. We are responsible for the wildland training and certification of all full-time firefighters in UFA. We oversee the national resources that are sent out to create revenue. We oversee the Camp Williams Wildland Program, and we're responsible for the coordination with the state of Utah to ensure our good standing with the Utah Wildland Fire Policy. The national resources that we send out create almost all the revenue for our budget. They bring in about $1.8 to $2 million annually, and this is the majority of our funding source for the division. Those resources that go out on these fires bring the training and experience back to UFA, and because of this, we're in a much better position when fires happen in our service area. The Camp Williams Fire Program is funded through a contract with the National Guard, and we provide wildland fire protection on the base. The contract was recently negotiated to increase annually by a small percentage, and so this will help future years due to cost increases of COLA, market increases, and CPI. So the contract amount fully covers all the aspects of the program and is no cost to the organization. The Utah Wildland Fire Policy is something else that we manage, and that's basically the insurance plan backed by legislation that agrees to pay for large wildland fires in our service area. So in exchange for that, we have to make sure that our crews are trained for initial attack in our area. We have to write community wildfire protection plans, and we have to do a certain amount of in-kind hours every year. So this year, the Wildland Division is asking for $157,000 to fund or partially fund a fuels crew. And that crew is responsible for completing the work outlined in that fire policy, and that'll meet our obligation for this fiscal year. The crew was funded last year through the Wildland Enterprise Fund, and because of the slow fire season, we won't be able to fund it again without the support of the $157,000. So the majority of what this crew does is mitigation work around our homes in our service area. They conduct community education days. They're really big in the chipper days, and they respond to local fires in our area. So on page 172 of the budget document, you can see the wildfire risk in our service area, and it gives you an idea of what we're trying to mitigate. So everything in red is considered high risk. So all the work that this crew does is over time going to reduce that risk into orange and potentially green. So last year, the crew did 4,000 hours of community hours of work. And they responded to 10 local initial attack fires. So this year, I expect a lot more out of them. We're increasing that number from 6 to 10 to staff. And I've been able to capture $150,000 in grant money that will help fund the rest of that crew. So as a whole, their total ticket is around $300,000, but only 157 of that is what I'm asking for funding. All the other areas of the wildland budget have been cut to meet the direction given by Chief Peterson. And that's all I have for that. Are there any questions I can answer? Tony, you're on mute.
Thank you. Okay, any items, board members, that you'd like to add to the deliberation worksheet from Wildland? Okay, seeing none, we'll move to our next section. We'll ask Chief Burchett to put on his other hat, and we'll introduce him as Assistant Chief Burchett, and he'll be introducing the support services portfolio.
Okay, thank you again, Tony. Yeah, I'm switching hats a little bit. I'm in the transition period, so here in a few weeks, I'll be moving in officially to the Assistant Chief over Support Services role. And since I am new to the position, I've just taken the opportunity to meet with the divisions in the support section, which that includes logistics, information technology, fire prevention, special enforcement, and urban search and rescue. So support services as a whole is here to provide support to our employees so they can do their job safely and effectively. Two major changes to the support services portfolio are the addition of the special enforcement division and the oversight of the Les Olson contract by the IT manager. All of the division chiefs have taken the direction and guidance from Chief Peterson to prepare a budget that's fiscally responsible with an emphasis on essential services. With COVID and the potential global budget impacts, I believe that all the division chiefs and support services have done a great job in preparing a budget that's sensitive to the current issues. They've all had to really take a hard look at their needs versus their wants, and I truly believe they're presenting you with a consistent and reliable budget for each of their divisions. They will take the time to present their respective budget and answer any questions that you may have. So Tony, if you want to introduce Zach.
Be happy to. So yeah, we'll start with our logistics division. And Zach Robinson, our division chief, is here and in the meeting and ready to go.
Thank you, Tony and Chief. Good morning, Chief Peterson, members of the board. Again, Zach Robinson, Logistics Division Chief. I'd like to take just a couple seconds to kind of give you a brief overview of what we do in our division. We provide 4 department-wide services. The first is communications. We provide coordination and support for all communication systems, including station alert systems, mobile radios, handheld radios, cell phone systems, all our landline phones as well. We also provide for facilities. There we provide utilities, maintenance and repairs for 25 fire stations, as well as EOC and 2 additional support facilities. In fleet, we provide procurement and a full range of maintenance and repairs for 341 mobile assets. And then also supply, where we provide procurement, warehousing and distribution of equipment and supplies for all UFA fire stations and support facilities. So I'm happy to have the opportunity to present our 2021 budget to you. It begins on page 195 of your PDF. Our primary focus this year was to try to really identify and reduce the cost of support services in Logistics Division. We really worked hard. We scrutinized all of our lines to try to find any cost savings we could, and hopefully you'll see that reflected in our budget for this year. A couple of the key cuts that we made this year, the first of which was elimination of a part-time fleet data assistant position. That was about a $22,200 reduction in our budget. And secondly, there was a $20,000 reduction in our overtime budget, which equated to about 16.5% reduction in that overtime line. A few of the key projects we have in our budget for this year. The first is a continuation of an ongoing program that we have for firefighter turnout replacement. The cost for this year is $85,500. And that'll purchase 30 sets of turnouts. And what this does is replace turnouts that are nearing their 10-year service life. That pulls those out of service and replaces those with a new set of turnouts. It helps us keep in line with the NFPA 1851 standard for firefighter PPE. The next project we have is installation of 31 safety sensors on overhead bay doors. This project costs about $22,000. And it'll resolve a safety issue that we have in a few locations. And next is hydrostatic testing of 530 SCBA cylinders. That project cost is about $15,900. On the personnel side, we've requested funding for standby pay for 2 communication staff members who are currently serving and will continue to serve in an on-call weekly rotation with 2 members from biotech and medical division. That cost to our division is about $7,800. I'd also like to highlight a couple of transfer of expenditures, if I could, from other divisions into our division. The first is a $25,000 transfer from fire training into Logistics Division. This transfer will allow us to maintain the fire training equipment as well as fire training buildings and grounds, something we do for all the other facilities. This will just bring fire training into that fold as well and allow us to track that all in our budget. Second is $36,000 transferring from IT into logistics. This item was previously considered software, however, it isn't. And so it was moved over to Logistics Division as a communication asset. It's an annual maintenance plan for our via phone systems. And what that provides is hardware, system monitoring, and software updates for our phone system, our landline phone system. And I'd like to take a second to address Board Member Perry's question about the janitorial supplies and services. This line over the past couple of years has kind of been my arch nemesis. It seems like we're always chasing this line. We've made some efforts to try to cut costs where we can in the items that we provide to the stations. And so we've over the past couple of years, I've noticed that we've not quite budgeted enough. And then this year, on top of that, we had an increase in our cost for janitorial services at both EOC and our contract in that provides services for fire training and logistics. So those two increased at the same time, as well as we didn't really quite have enough in budget to accommodate the supplies that we're sending to the stations. So recognizing that this year, I just made the additional leap to try to capture all that and reflect our true cost in this line. rather than continually chasing it and being over budget year after year. So that's where you're seeing the increase, the big increase there. Hopefully, Board Member Perry, that addresses your question. And I'd like to answer any additional questions you may have.
Yeah, thank you. I have a couple questions. Oh, Harris beat you this time. It was interesting for me to see the cut in the clothing provisions by $150,000. I mean, you look at the overall budget of the division, and obviously it's to the good for as far as last year, this year. But the clothing provisions, is there something that's happened there? And also professional fees going up almost double. Yeah.
So the biggest piece of the clothing provisions was elimination of a program. So this year we purchased firefighter like brush gear. It's like a lightweight turnout system for fighting brush fires for all the stations and all the individuals. So with that coming out of our budget, that reflects the largest, by far the largest piece of that reduction. And then on the professional, I'm sorry, was it professional fees you referenced?
Yeah.
As the second one. So we've had some ups and downs in that one. There's a couple of new items in there. The largest being the $5,000 that you'll see there listed. Let me see here. Make sure I've got this right. There was a $5,000 increase in the annual fire hose and ground ladder certification testing. The largest piece, I'm sorry, is the $36,000 funds that were moved over from IT budget from last year.
Okay, that's where that is. Okay.
That's the largest piece for sure.
I've got a couple questions for you. I noticed that that this budget includes the same dollar amount for vehicle fuel as the previous budget, and I just bought gas for the first time in weeks, and I think I paid $1.78 or something per gallon, and I'm just wondering if that number is correct given the actual costs. And conversely, there are a couple items on here that seem not to have changed, but I wonder if they would go up. I mean, have you had to pay more for the PPE of masks and things like that than you would have expected? Food is more expensive, and I know that in our that hotels are being required to clean and launder things much more thoroughly and frequently. So I just thought to bring those up.
Sure. So fuel is we're projecting. I'm sorry. Our initial projections when we first started this were ahead of the whole COVID thing when prices really started to drop. So that was rather unanticipated. And we're seeing actually those savings right now in this current month. It was considerably less than anticipated. However, we are anticipating that those are going to increase again. Trying to, forecast the fuel market, it's pretty difficult traditionally over the years. So we've kind of just gone traditionally with what we've had from year to year as far as our use goes. And I'm sorry, your next question after that.
Oh, it's just some incidental costs for things like medical equipment for PPEs on masks, gloves, given COVID, and then food prices and having to, and I wondered if the bedding, and I don't know if it's in janitorial where you wash all that stuff, but I presume that those things are getting done more now under the pandemic.
Yeah, so we have seen in this budget, we do have an increase in our medical line item. As additional items are added and we're seeing these cost increases. Again, this was done ahead of the COVID crisis hitting us. We did hit several unanticipated expenses with this crisis coming on. We're pursuing some grant funding for future items, purchases, as well as costs that we've already experienced as one way to address this. Another way that we've addressed it is we were fortunate enough to have some considerable supplies on hand to address some of our needs immediately. So we didn't go right straight into a crisis phase when this initially occurred. So we've been able to rely on some of the items that we do have on hand. As far as some of the washing, a lot of that stuff is handled at the station level, and that may be reflective of some of the costs that we see increases at the station level for increased use of like laundry soap, maybe dish soap, disinfectant supplies, wipes, things of that nature that are being utilized more often than not. So that's part of what we're going to see hopefully be covered in our new increased janitorial supplies budget if that's approved.
Okay, any additional questions for our logistics division or any items that the board would like me to add to our spreadsheet?
I think, Tony, that these may not be very big items, but the ones that Chief Robinson and I were just talking about might be worth consideration.
Okay, so are there so we can put something for the fuel? Is there an amount you want to start with?
I wouldn't really have a good number for that, although I don't know, does UFA have fuel storage? We can get paid to store fuel these days, I think, but I don't know. It seems like it's 10% cheaper at least.
Okay. Well, okay. And then I'll add a medical supplies section as well, and we can.
That should go up a little bit, yeah.
Okay. So should I do 10% minus on the fuel and a 10% increase on the medical supplies? Is that an okay starting spot?
I would defer to Chief Robinson or Chief Peterson on a number, actually.
On the fuel side, I mean, that'll put us down to what, 450,000 on the fuel side. I'm comfortable making that move if these rates hold. I think we'll be okay there. And then on the other side of that, 10% increase on the medical supplies, we're at 515. If we were to bump it up, yeah, I mean, that's probably I'd say that might be slightly over for some of these supplies. That said, the supplies now cost more than they traditionally have, so that may be a good place to land for a starting off point.
We'll add it like that to the spreadsheet, and then obviously in deliberations we can move it up and down, do whatever we want, but at least we'll put it in there and we can see what it does to the member fee. Any other items for the deliberation worksheet? Okay, if not, we'll transition to our next division. That will be information technology, and we'll welcome the division leader for that division, Ginger Watts, to our meeting.
Hi, good morning. Again, my name is Ginger Watts, and I've transitioned over to the UFA from Salt Lake County Information Technology. And in my time here, my focus has been to partner with Les Olson to just continue to identify and prioritize things within our infrastructure, and also to give some additional functionality to some of our users. So going into this next budget cycle, there are definitely some increases, but those are really to get us current on our licensure from a server perspective, to build out Office 365 for some of our users. Plan a little bit better for disaster recovery. I think recent events have just kind of emphasized the need to have just a really good, strong infrastructure, and also disaster recovery. And some of the increases are also tied to consolidation of software. We didn't include emergency management software within the IT budget, but we have consolidated some of the software expenses from some of the other offices. Any questions?
Maybe you could respond to the increase in small equipment.
Oh, excuse me. That's a very good question. So the increase in the small equipment is for our disaster recovery backup. We want to put a DR site in place that we can have the systems replicating constantly, so that we will just never have any issues in the future, or very few issues in being able to access our data. And so that is the reason for that particular increase.
Okay.
Ginger, another follow-up on the computer software.
Sure.
Do you expect that line item to continue at that cost going forward, or some of those one-time costs to catch up on?
I would say that until we can get the organization on Office 365 and get some continuity across the board, at least for the next year or two, I don't foresee that that cost is actually going to go down. I wish that I could report that information technology is cheap, but it isn't, and to stay current. And the other issue you have is that in the industry, sometimes they're changing the pricing model. So where you used to just pay for a one-time license, now you're paying for an annual subscription. And so, you know, it just depends on the changes in the industry, but I don't see that that cost would go down until we can probably get everybody fully on Office 365.
Thank you.
You bet. Any other questions? Hey,
Okay,
thank you for your time today. I'm going to turn it back over to Tony.
Thank you, Ginger. Any items, committee, that you'd like to add to our deliberation worksheet?
I was still a little unclear on that small equipment price doubling. Maybe like a little further clarification on that personally, because it's just going from 20 to 40,000.
It's and that in particular is for offsite storage, so that we can have it's just a new backup system, so that we have a good failover.
Okay.
So Ginger, an ask on that is, I'm looking at that and I don't see it as a project in that line item, but is this a one-time cost or an ongoing cost of an increase?
That in particular will be a one-time cost until it's time to upgrade that equipment. And so there's going to be probably two components to it. It's going to be the hardware that we actually need, and then to pay an outside agency to for the storage itself. And so I think that isn't a cost that I would expect to see maybe in next year's budget. That should carry us over for some time.
How much of this increase do you think is one time versus ongoing once you balance the other part of it?
I would say that with the hardware specifically, or let's see, I'm looking at 410. I would see that cost could very well drop by that 21,000 next year.
So we may see a return back to what the budget was last year, but you'll have some new cost of maintaining it that'll be embedded somewhere else, right?
Yes, correct. Good question, Chief. Thank you.
Do you know how much that new cost will be embedded long term?
I think the quote I have been given by Les Olson is about 6,000 annual to do the hosting services.
So we'll probably see this line item drop, or the total net of this change dropping by about 15 to 17,000 next year.
Yes,
so
I believe so.
20 of it is a one-time cost.
And then that cost to actually support the data offsite would probably fall into 330 in the future.
Okay, thank you.
You bet.
Can you say something about the distinction between the row 330, which is a pretty big number, and 235, which is also a pretty big number?
So with 330, part of the reason for that increase is because we did consolidate software from almost every division with the exception of emergency management. So that is one of the reasons. And then I'm sorry, your other line item?
Well, I guess I'm asking about what maintenance of software means compared to computer software non-capital as categories.
So the difference there would be there's typically annual maintenance associated with most software, And so once you pay, it's the difference really between the initial cost and then the ongoing cost. So the maintenance is always going to be the ongoing, and the other is typically that initial purchase. Did I answer your question? Oh, you're muted.
So to get back to Alan's question about that computer and software non-capital initial purchase, I mean, I understood you to say that if we move to everybody over to Microsoft 360, things will be cheaper. So is this what is that $102,000 the transitioning of people's machines into that?
Yes, and that will still not have us fully transitioned.
I see.
And one of the reasons for that transition is that we want to be able to get on SharePoint so that we don't have to pay separately for document management. We want to be able to create an intranet site and hopefully eventually move everybody to Microsoft Teams. So right now we're using Zoom like a lot of people, but all of those elements are within that licensure. And so that's one reason why I don't foresee that going down, just because we have about 650 users. Some of those are part-time, some are full-time. Mm-hmm. And so that's just going to be an ongoing transition for us. So that cost is probably just not going to go down for a little while.
Okay, any further questions or anything you'd like me to add to our deliberation spreadsheet for information technology?
Awesome. Hey, thanks again for your time, everybody. Good questions.
Okay, we're ready now then for our next division in support services, fire prevention division, and our division chief, Brad Larson, is on and ready to go.
Great. Thank you, Tony. Good morning, Mr. Chair, committee members. Thank you for your time today. Really appreciate it. I'm Brad Larson, Division Chief and Fire Marshal for your UFA Fire Prevention Division. Our main goal is to keep the public safe as they enter a public space. We work really closely with your city staff to assure that the development in your communities moves forward in the most cost-effective manner possible, while also assuring that the fire and life safety provisions of the fire code are met to keep the community safe. Just a quick overview of what services we provide. We do technical plan reviews, fire safety compliance inspections for new construction. We have a hazardous materials permit program, an annual inspection of those facilities, which is nearly 700 now. Standby duties for large events, and annual inspections of hospitals and critical care facilities. We feel those are really important. That's something that we do every year. I want to touch briefly probably on the major thing in our budget, which is the request for an additional inspector and overtime for an inspector cadre and the benefits to your community. We've been looking at this for several years, and we're doing really well in construction and inspections, helping those move forward in development in the communities. And some of the other items I mentioned, the inspection of the critical care facilities and the hazardous materials permit program. We've got a pretty good handle on that. However, we took an inventory of the existing buildings and businesses that we would consider high hazard. Those are listed on, I think, page 209. And we're struggling to get to those regularly, which opens some liability for our communities. And so we've been looking at ways that we can start getting into those. And as we have studied and looked at a study commissioned by Homeland Security and the National Fire Protection Association, completed in conjunction with the Fire Protection Research Foundation, we think that adding another inspector is going to really help in getting into some of those facilities that we're not getting into on a regular basis. The initial inventory list we came up with was in excess of 900, and adding another inspector, we can get into at least 250 more of those a year. And some of those higher hazard buildings are occupancies that are subject to a high incidence of fire by national statistics and also statistics we looked at here in UFA. Ones that may have a higher life loss due to fire, and essential infrastructure buildings such as your city halls. This position would provide a well-trained technical expert for the more complicated buildings to assure life safety systems are maintained. It would provide consistency in the application of the code and the manner in which it's applied. We prefer a consultant-like approach rather than a heavy hand or a badge. The fire crews are still going to perform some of the inspections on the lower hazard occupancies, so this will take a little pressure off of them with all their other duties that they have and the training that they have. The big thing I think is it will help us meet strategic outcome for public sector risk reduction. The inspector cadre, just briefly, an operations personnel would come in 1 or 2 days a month on their day off to help with the inspection load. And it would also provide training and preparation to that individual or individuals in support of their professional development plan toward a position in fire prevention. I do want to clarify one thing on the bottom of page 209. I want to clarify that next year the plan is to discuss and present an incremental plan to add 3 more inspectors over time to capture the remaining 750 high hazard inspections on a regular basis. That in a nutshell, there aren't too many other changes. We did make some reductions in the non-personnel line items, but we feel we're pretty good there. So with that, I would ask if anyone has any questions.
Yeah, one question, and whenever there's a request for another FTE, it always is a question to me. So you currently have 10 full-time sworn officers and 2 civilians, is that right?
That's correct.
So how long have you been staffed at that? Have we had increases over the years? Has it been pretty stagnant for a long time, or?
We've actually had a little bit of a decrease. When I first came into UFA in 2012, we had an additional staff member. We had Chief Higgs was the fire marshal, and then we had 2 deputy fire marshals, myself and one other individual. That individual left UFA and we never replaced that position. And so essentially we have 8 inspectors right now. And you remember last year, you approved 2 deputy fire marshal positions for us, which we appreciate greatly because that really helps on our oversight. But those 2 positions came from within our ranks right now. So we didn't increase personnel there either. And they, in addition to their supervisory and training responsibilities, they still kept their responsibilities for their cities and inspections at this point. So the addition of another inspector is really going to help kind of even out that load and help us get into those businesses that we're not regularly getting into that we need to.
Okay, thank you. I've been to the expertise of the chief. Valuable service.
Thank you.
Really quick, this is Councilmember Stewart. I have a quick question. What type of inspections are the normal crews at our stations doing?
They're doing some of the higher hazard and the moderate hazard right now, but it's really difficult. As pointed out in the report, and we face the same challenge. I'm talking about the report from National Fire Protection Association, is that many times when a crew goes and does an inspection, they'll get hit out on a call and they may or may not be able to get back. It's a real inconvenience for the business owner. There's a little bit of inconsistency there, and they may not be able to get back till the next round. And then too is the training aspect on the technical end. The crews are trained in basic fire prevention things with keeping exits clear, fire extinguishers and that type of thing. And there are instances where, say, for example, the warehouse is built and apologize for taking time to go into detail, but I think it'll help you understand why the technical expertise is important on some of the higher hazard buildings. Business will come in and they'll store some goods 12 feet high, which the fire sprinkler system is designed to handle ordinary combustible materials up to 12 feet high. They'll move out and another company will come in and lease the space, and they'll store some higher hazard plastics or foams, mattresses and such, and store them 16, 18 feet high. And the fire sprinkler design density is not designed to handle that. And so if we have a fire, we're going to lose the building and maybe hurt some firefighters. But our staff are trained to know what the fire sprinkler design densities are, how high commodities can be stored, what type of commodities can be stored. And so we can work with the building owners and the business owners to help make sure that that building is protected properly. So again, this will get a technical expert into the higher hazard buildings. The crews are still going to go into some of the moderate and lower hazard facilities, inspect them. The other thing is on the higher hazard facilities, we can have this individual work with the crews and come along with him, which will not only help them in some training, but the pre-plan portion of it, where they can come in and be familiar with the building in case something happens, so that they can mitigate the hazard in a good manner, would be very helpful. Pre-planning would be very, very, very beneficial, and this individual can help with that.
Thank you.
Long answer.
Okay, any items that you'd like me to add to our spreadsheet? Okay, then we'll transition to our next division, Special Enforcement, and welcome Division Chief Steve Ball to the meeting.
Good morning. First, I'd like to start out to express my appreciation for the opportunity the board gave, the full board, not just, obviously the Finance Committee, but the full board, for the opportunity to present at the March board meeting, give an overview and a history of the Special Enforcement Division and our services provided. And I'd like to really thank the board and show my appreciation for your support and recognizing the service that we provide to the community. I'm not going to go through the entire services provided and statement of purpose unless the committee members would like me to, since I just addressed most of those things in the March UFA board meeting. And I'll just go right into the meat of the budget if that's okay. For the most part, what you'll see in Special Enforcement is a flat budget with a couple areas that I wanted to address specifically. One is a transfer of from emergency ops to Special Enforcement of a investigator for 1 quarter of the year. We did this last year during the background investigation portion of the new hire process, and we were able to perform 52 background investigations on potential new hire employees and making sure that we got the right individuals and people that met our defined values as an organization and get them into recruit training. That was a pretty big undertaking for us, in bringing in that additional investigator who fills a role as a part-time fire investigator, part-time bomb technician. Bringing him in for that portion of the year was tremendous, not only to get the background investigations done in a fairly expeditious manner, but also to keep up on the other tasks that we have to do during those time frames, as far as training and responses. So that was a big thing. You'll see that that's captured in the budget. We didn't capture that last year. That was kind of one of those ideas that we had mid-budget year, and so we borrowed him from emergency ops. This is just a capture of that to continue that this year, anticipating we have a similar number of background investigations to perform in that time period. We were able to get those done and have conditional job offers to those firefighters between the first, I think, conditional job offers went in before Thanksgiving, and with the final ones coming in before Christmas. So we'd like to continue to do that. If the number of new hire employees that require background investigation is less than what we anticipated last year, we would certainly return him to ops early and not maintain him for that period of time. But we'll have to wait and see how many backgrounds we have to do. You also see an increase in the training budget. Again, this is more of a movement of money from medical to or from EMS to special enforcement. Last year, we put on a cadaver lab. We've done that annually for the last couple of years for our SWAT paramedics. And medical was paying for that. Last year, they didn't budget it for it. So we covered that out of the training budget from special enforcement, and we wanted to capture that this year. So you'll see that cadaver lab is an increase in the training budget for those SWAT paramedics. And that covers the cost of the cadaver lab, which was about $1,830 plus the supplies that we used during that. And so that's in there too. One of the projects we have is an X-ray generator replacement. These are used for our digital X-ray systems when we're either X-raying suspicious packages, confirmed IEDs, or even in fire debris analysis for fire investigations. We have two that are 15 and 20 years old respectively. We have issues. The batteries have been discontinued. The technology is changed, and so those units are getting a little bit older. I believe that I'll be able to obtain grant funding for that project, but I wanted to capture it here anyway. And then one area we think we might be down a little bit is in our event billing, where we bill for some security and explosive detecting canine services for third-party type events like marathons, the Ironman marathons. We get a lot of requests to send our dogs to some of these outside events. None of those are ones that would be sponsored by your communities, or in the case where we're requested to provide VIP security or event sweeps for dignitaries that are not a third-party vendor. So those are the kind of the areas I wanted to highlight very quickly. If you'd like me to, I can go into some of the performance measures that we've accomplished or some of our accomplishments. But again, I think we addressed some of those in early March, but I'd be happy to go into those. And I'd also be happy to entertain any questions you might have for special enforcement.
Chairman Stewart, I'm concerned of how long our meeting is going to last. I have a stop time of 11 o'clock. I didn't think we'd go 3 hours, so I hope we can.
I'm hoping so too, because I have an 11 as well.
Okay, well, we can move forward then. We really, maybe it's the pleasure of the board. We have our USAR division left. They're mostly funded by the grant. We can bring in Division Chief Case quickly if you'd like. And then the final items are the capital replacement funds, and we're just requested about 6 items to be purchased out of the fund balance there, only about $379,000. So those are the last 2 items. We can skip those and move to deliberation, or you can have a quick review. It's up to the board.
I would suggest taking a couple minutes quickly on each one, but I'll let the chair decide.
Yeah, let's just take a couple minutes and move quickly.
I don't really have any questions on the remaining ones, but.
Okay, well, Brian Case will quickly cover USAR.
Thanks, Tony. For the second presentation, I'll be reporting to you on the task force. We're one of 28 federal disaster response teams located around the country. UFA is the sponsoring agency. We have 6 other participating fire agencies that contribute members to this task force. So we have about 200 members. These members bring to this program and back here to UFA a lot of partnerships with the state and national levels. We seat several people at the national level through their expertise here. And we have national and international reach that comes back to live here at home within UFA and within your communities, respectfully. The team is also made up of ER physicians, structural engineers, and we respond as a state asset as well as a federal asset, having recent exposure to the March earthquake with our structural engineers. So with that said, I'll tell you real quickly that we pay for 24% of the space that we occupy out here in logistics. We are 100% funded, save a small amount by the federal government through the Department of Homeland Security and FEMA. There are 2 small adds. We're continuing to ask the UFA for a $10,000 professional support fee that helps us procure items beyond what is allowed by the federal grant. And then UFA has pushed $10,000 into this budget to account for my time in supporting the development of the new strategic plan. And that's it in a nutshell. Hopefully that was quick and concise enough. If there's any questions, I'm happy to entertain them. Thank you.
No questions for me.
Okay, any items for the list? Okay, then I'll quickly then cover the last item. That's the capital replacement purchases. We're on page 231. There's really, the request this year is for 6 items to be purchased out of the fund balance. There's no new lease this year. That'll hit next year. And so the 6 items total about $379,000. And so, yeah, we'd be happy to answer any questions on any of those items, but they, like I said, being paid out of fund balance, if we reduce any of those, it doesn't affect the member fee, it just affects the fund balance in the replacement fund.
I just have one question. I'm all in favor of protecting the firefighters from ice that has diesel fumes in it. But is it necessary to buy new ones rather than, if they're going to be moved into the quarters, rather than just move the existing ones out of the bays into the quarters?
If we can bring Division Chief Robinson in quickly, he can answer that question.
Sure, I can everybody hear me okay?
Yeah.
Okay, great. I can answer that quickly. So these are actually different machines. The ice machines will not be able to be moved into the station quarters because they require drains to be installed. So it would be a big task to do so. So these are actually similar to the water-only machines that we currently have in the stations. These new ones simply provide ice and water and replace those units. So we'll offset the cost somewhat by eliminating that lease and bringing in these new purchased units.
Okay, any other further questions? Okay, if not, we'll move now to the deliberation portion. We'll turn it over to you, Chair Stewart. I'll share my screen with the items that I've captured, and then you guys can have your deliberations and we'll go from there. So Chair Stewart.
Okay.
Can you guys all see the screen?
We can now.
There's about 7 or 8 items on there.
So any of these items here that anyone wants to just immediately request be pulled off? Any adjustments?
Let me just take a second. Does this make sense? So the first column just has the adjustment. Then you can see the impact to your member fee in the second column by percent. And then we can go across and see what the impact is per the member. So really kind of that, if you're interested in what it does to the member fee, kind of column C and D will tell us that.
So on the first line, why don't we just go line by line on row 4 here, the maintain current AC step, eliminate the redlining. Is everybody in support of continuing with the chief's recommendation?
Mayor Peterson, I'm supportive of that.
Okay. I guess I should say anybody that objects.
Councilman Stewart, as a suggestion, you might consider, I think, this as a consent agenda and just approve the whole thing, or go through line by line, since many of you have a stop in like 2 minutes.
Okay. Well, is there anything on here that anybody objects to or would like to see changed?
I don't object to any of them. I think the last 2, which is gasoline and medical, I think that might just maybe, is there some review that can be done of those 2? But if the administration feels that those are doable, I'm supportive. But yeah, they seem to be a little bit arbitrary. Yeah.
I think to consider that they're almost a wash inside the budget, and you could eliminate those two without any real impact to the line item, and they could fluctuate back and forth inside of his budget accordingly if you'd like to do that.
Yeah, and I would agree with Chief. We already have a procedure that if we have significant shifts in budget, it comes back to the Finance Committee anyhow. Like if we're swapping from one line to the next.
That's fine. It's especially since it's a coincidence that they're the same amount of money.
Yeah. I have a question to the chief. I didn't put it on the list, but I assume every division would have justification to some degree of a new FTE. And so with the request for another fire prevention inspector, is that something that's been vetted and supported by the UFA administration?
Nothing in this budget hasn't been vetted and supported in that way. I support the move. I told him it was vulnerable because of a new position. I believe it's vulnerable, but the key is, my biggest concern about our prevention division is that they are reactive, and there are large assembly occupancies that we are not able to get to often, and not ones that I'm comfortable sending an engine crew in to make sure that some of these facilities are safe. So I do believe that we're 3 or 4 positions short, and this is the first step of adding one is my recommendation.
Terrific. Thank you for that clarification. I want to make sure that that was vetted.
So are we ready for a motion to recommend submission of this budget?
As long as there's no more discussion, I'm looking for a motion.
Okay, Harris Sondak, recommend submitting the proposed budget with the changes that were just discussed to the Board of Directors of the UFA for consideration.
Okay, do I have a second?
Mayor Gale seconds that motion.
Okay, roll call, Cindy. Cindy.
Sorry. I've got Galley,
Yes.
Hale,
Aye.
Peterson,
Yes.
Silvestrini,
Yes.
Bondak,
Yes.
Stewart.
Yes.
Okay.
Okay. So I think we've wrapped everything up. Just looking at, I don't see anything else on here, so looking for a motion to adjourn.
Mayor Gale, so moved.
Okay.
Aye.
Yeah, it was Dolly, Cindy.
And Silvestrini second. Okay.
Sure.
Roll call, Dolly,
Yes.
Hale. Mayor Hill. Thumbs up.
Well, he said yes, but he's muted.
Okay. Peterson,
Yes.
Silvestrini,
Yes.
Bondak.
Yes.
Yes.
Wonderful.
Okay, we're adjourned. Thanks, everyone.
Thank you, Chief. Excellent.